Sir, shall we start the session, sir?
Yes, you can.
Yes, sir. Humble pranams to the gathering. Welcome you all to this beautiful evening. Let me begin by quoting the inspirational words of John Quincy Adams. If your actions inspires others to dream more, learn more, and do more, become more, you are a leader. With great joy and immense pleasure, I extend my warm welcome to all the dignitaries, guests, and delegates present here for the third day of AyurCon 2022, a national Ayurveda web conference organized by DIKSHA Academy under the banner of Ayurved Ka Amritkal, initiated under the visionary guidance of Indian government. India is marching ahead with a vision of making India a real leader in all aspects. To contribute towards this vision of making traditional medicine more accessible to all during the Amrit Kal, let's become a part of history marking the golden period of Ayurveda. Today, we are fortunate to have Dr. Pundarikaksha Rao sir with us to discuss on the topic Jatrudva Medo Viharas with special reference to metabolic eyes and ENT diseases. Dr. Pundarikaksha Rao has over 10 years of teaching experience and working as professor and HOD in the Department of Shalakya Tantra of Ayurveda College, Coimbatore, Tamil Nadu, and consultant Ayurvedic ophthalmologist and ENT specialist for Saigram Hospital and AVP Research Foundation, Coimbatore. He has completed post-graduation from Dr. BRKR Ayurveda College and Research Center, Hyderabad, Telangana in 2011 and BAMS from SV Ayurvedic College and Hospital, Tirupati, Andhra Pradesh. His major area of research interests are eye and ENT. During his distinguished career, he has published 56 scientific papers in peer-reviewed international and national journals, delivered 48 guest lectures and paper presentation in national and international seminars. 219 patients of eye and ENT were operated surgically by Ayurvedic method and more than 8,200 patients were treated so far by non-surgical method. He is also in panel of reviewer board, International Journal of Clinical and Experimental Ophthalmology, Asian Journal of Pharmacy, Nursing and Medical Science. With utmost pride and privilege, we welcome you to our platform, sir. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection first. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Now, without any further ado, we will turn the time over to respected Dr. Pundarikaksha Rao sir to enlighten our minds with his knowledge. Over to you, sir.
Thank you. Thank you so much.
Thank you, sir.
Okay. Welcome all. So today we are somebody can allow the people who all are joining because
yes,
it's
sir. We will
interrupting.
be doing that, sir. Yes, sir. We will be doing that, sir. Yes.
Okay. So actually, I'm suffering with cold, fever, cough, and everything is there at a time. But already I committed to Diksha to do this procedure, this presentation. So I am doing that. I think if any in between any disturbance with my cough and all, please forgive me about that. So today I taken one different topic because Diksha is doing there is a Vedava Srotos Vikaras. So that Anjima madam told me to take this one topic related to I and ENT. I was totally blank, okay, to start this topic because there is we feel that it's nothing relevant to Shalakya. Is there sometimes only we may think or some diseases which are commonly we'll see like a Galaganda, Gandamala, some diseases only can be occurred with Vedo-Srotas related. Remaining all are Prameha related. Maybe we can tell diabetic retinopathy also can included in this. So I was totally blank. So around more than 10 days, I was thinking what I have to start. So where I have to start, what I can do, what are things can be included, was totally, it's like a new for me. Okay, then slowly I was thinking that why can't we do this topic? Okay, I took this as a small challenge and started working on this. But I not covered all the things because it's, I thought after starting this, I felt it's a very big, vast topic. Before that, I was thinking it's very small topic. Once I started working on this, it's very vast topic and it's very difficult to complete in the 1.5 hour. Okay. Anyway, superficially, few things I will start to tell you. Already, I think 2-day sessions are completed. In these 2-day sessions, different Medo Srota Vikaras we observed. I think you got good idea about the Medo Srotas. Because if it is going in a simple one Srotas like detailed study will helpful for each and every doctor. Okay. So without delay, I will start my topic. So just I will give the brief things what already you covered in the other sessions. Just I will tell what is Medas and what is Medavasrotas and what are the abnormalities can be occurred in the Medavasrotas related and what are the other points can be we have to think related to Medas. Okay. So some few questions for the audience. Okay, who all are there? Please, if possible, type in the chat box. So which all are organs developed by the Medas? I think who all are studied for PG, they can give answer easily for this. Anyway, try to recollect which all are organs developed by Medas. Is there any organs developed by Medas? Okay, think once. So Medas is it fat? More than that, any other thing is there? And I think Vrukka, someone is posted. Yes, some more are there. Okay. And functions of Medo Dhatu Agni. What is the main function of Medo Dhatu Agni? Is it necessary to know about the Medo Dhatu Agni? And what is the number of Medo Dharakala? So different Dharakalas are there. I think all of you remembering. So just you can try to recollect. I will, okay, I think it's covered in other sessions. Okay, just I will give the brief about this. So when we see the Medas, we have to know whether it is a what is the things related to anatomical aspect of Medas and what is the physiological aspect of Medas, what are the pathological things related to Medas, we should know. Okay, so usually we'll think that Medavasrotas, then we'll go directly Staulya and Premeha. So we'll think in that way. Okay, we having that super specialty level thoughts. Okay, first of all, we should be in the basic level thoughts also very important to build our career. Okay, we have to improve our knowledge. So what is the anatomical aspect of Medas? You know very well, everybody knows from the first year onwards, they tell that it is Dhatu. Medas is Dhatu. And it is a fourth Dhatu, Rasa, Rakta, Mamsa, Medo, Asti, Sukra. Okay, and Artava also included in the this Dhatu, Sapta Dhatus by Bhava Prakasha. That is a different point. Okay, so 7 Dhatus are there. And in this fourth one is the Medas. So just I am just building the basic, the platform. Okay, we are going near to the Jatrurdhagata. Before that, we should know some basic things. Okay, so we know though it is located in Udara and it is located in Vrukka, Medas is developed, it is present, it is accumulated in the different areas. So we'll think that this is the locations. When we see the modern aspect of the fat deposition, they will tell the different areas, okay, in the thighs, in the abdomen, in the back, okay, there is a pear shape, okay, different shapes also they are giving. Other than that, we should know what is the location, okay, where it is located. Okay, and there is a pramana. Medas is 2 Anjali pramana. When we see there is a that from Jalam, okay, there is a nine Anjali pramana, Rasa, Rakta. They are given the Anjali pramanas about each and every fluids present in the body. Okay, not only fluids, that substance, solid substance also they given the measurement. Okay, okay, please forgive me about my voice because little cough and cold is there. Okay, so just you can try to understand what I am telling. Okay, so here Medas, all people they'll think that Medas is fat. Apart from fat, something else. Okay, something else, because you see here Pramana, Medas is 2 Anjali Pramana, Vasa is 3 Anjali Pramana. Okay, Medas is 2 Anjali Pramana and Vasa is 3 Anjali Pramana. Okay, that all together we may think that as a fat. So maybe lipids or fatty deposits all together we may take. Okay, so Medas and Vasa both are not same. And Medo Dharakala, okay, it is Udara Anuasti. It is present in Udara and Anuasti. Anuasti means very small bones. Okay, it is present in that. Okay, it is a layer also. Okay, the Medas, it form as a layer, not only deposit. It will be form as a layer. Okay, maybe momentum. You may tell some people it is a momentum like. Okay, and so we think that Medas is not only fat. Okay, it is not only fat. And so this is the question I asked you before. There is a Sonita Meda Sara. Rukka forms with Sonita and along with Meda Sara. And Sonita, Mamsa, Meda, Kafasara, it forms as a Rukka. Okay, Sonita, Mamsa, Meda, Kafasara. And this, not only this, okay, Meda Sneha, it is cooked up with Pitta and Vayu. If it is in the Mrutupaka, it forms as a Siras. And it is in the Karapaka, it forms as a Snayu also. Okay, so blood vessels, okay, the blood vessels also which form with Medas. And tendons, okay, different type of the tendons that also can be formed with Medas. So because of that, the fat easily accumulate inside the blood vessels. Okay, because when we see there is a fatty deposit, there is a heart attacks. Usually you can get how the fat is formed around the heart, how the heart is getting blocked, blood vessels are getting blocked. This all are because of the Medas, which is the Siras, which is found because of the Medas only. Okay, so Medas Neha, because that Medas Neha, it is cooked up and it forms as a Siras. Okay, so when we see the physiological aspect, there is a, you know very well, Medo Dhatu Agni. One it is we having the different type of Agnis. There is a one is Jataragni, Dhatu Agni, Panchabhuta Agni. Totally 13 type of Agnis are there. In that, there is a Dhatu Agni. One of the Dhatu Agni is Medo Dhatu Agni. Now, where this Medo Dhatu Agni is working? Where it is working? In between Rasa and Rakta, or Rakta and Mamsa, or Mamsa and Medas? Where it works? Okay. So there is a Rasa Dhatu Agni is very important to convert Ahara Rasa into Rasa Dhatu. Okay. Rakta Dhatu Agni useful for converting Rasa Dhatu into Rakta Dhatu. Okay. Then Mamsa Dhatu Agni from Rakta to Mamsa. Medo Dhatu Agni from Mamsa to Medas. So it will be convert. Now we should think, if Medo Dhatu Agni is low, okay, if the Medo Dhatu Agni is very low, so what will happen? So Medas will not form properly. Okay, and it will accumulate. Okay, it is not properly formed. It will not convert into the next dhatu also. So it will accumulate there. If Medo Dhatu Agni is more, so because of that more Medo Dhatu Agni, Medas is formed high level and it accumulate in the different body parts. Okay, try to catch the point. If the Medo Dhatu Agni is more fatty deposits present. If Medo Dhatu Agni is low, there also we can observe more fatty deposits. Like there we observe that it is a not properly formed lipids. We can tell that LDL or HDL. Okay, we can take in this way. So once the Agni is properly working, proper fat or Medas will form in the body. Proper Agni is not there, the Medas is not accumulate in the body. So like that only we are getting the diseases. If it is all the Dhatu, Agnis are in the proper way, Dhatu is formed properly and disease will not occur. So Dhatu Agni is not properly there, then it can lead to development of the particular Dhatu related diseases. So Agni Vruddhi also can cause the disease. There is a Alpata also can cause the development of the disease. And what are the Vruddhi Kshaya Lakshanas? There is a Pleha Vruddhi, okay, Sandhi Sunyata. The person is getting, there is a Sandhi Sunyata. There is a space, okay, the person is feeling something is empty in the joints, okay, and dryness of the skin, and willing to take the Medo that and Mamsa Dhatu related food, the meat items, okay. And another way, we'll get the sweating, increase size of the abdomen, Kasa, Swasa, Dorgandhya, these all things can develop. Okay, so Buddhi Kshaya Lakshanas, it is in the physiological aspect. Okay, Medo Dhatu, that you remember this is a Medo Dhatu Vruddhi Kshaya Lakshanas. Okay, Medo Vahasrotas. This Medo Dhatu is flowing in the Medo Vahasrotas. Okay, so not only this Dhatu along with Vata, Pitta, Kapha, everything is moving in this, in the particular Srotas. Okay, Srotas is telling like it is a Akashabhuta Pradhana thing and it is present in the body fully, not only in particular area, it having the particular color related to particular Dhatu, that everything you know very well. Okay, so once it is moving in that Srotas, it will lodge in particular area and it will develop one particular disease. Okay, where there is where the Kavaigunnata present. Where the Kavaigunnata present, there the disease can occur. So if any Sroto Drushti happens because of the food items, because of what are the works we are doing with this, if it is Kavaigunnata is there, then it causes the development of the diseases in particular. Okay, so not only Medas related, there Upadhatu Malas also will affected with this. If the Medo Dhatu Agni is not properly working, and if it is a Srotas is vitiated with particular things. Okay, Snayu related diseases, and the Mala is the Svedam. Okay, Upadhatu is the Snayu of the Medas, Mala means Vedas, Asti Pushti is the function of the Medas. So Asti Pushti is happening because of Medas is properly converted. Okay, Medas is properly converted, then Asti Pushti can develop. Okay, so if the Dhatu Agni is not properly doing work, Asti Pushti will not develop. Now, I will tell one point. Asti Pushti is not properly there. Okay, so Asti is not having strength. Asti is not properly formed. Then the any dosha is related with Asti. There is a Vata dosha is there, no? So Vata dosha is related with Asti. So there is a, I think, okay. Now is it okay? My voice, somebody told, okay,
Yes,
voice.
sir. It is clear now, sir. Yes,
Okay,
sir.
okay. So Asti Dhatu is not properly formed. Vata is vitiated. So Vata is vitiated, Vata related diseases can develop. Okay, see what is the Medas, where is the Medas, where is the Vata Vyadhi? See, these all are the interlinked. These all are the interlinked. For that only I am telling directly, don't go directly into the Srotas and disease related study. before going to the disease related study, just you should revise, you should make the proper platform. Okay, there is a different books are there related to this Agni. Okay, there is a Ama related this textbooks are available. Okay, go through once. There is a C. Dwaraknath written one book, okay, related to Agni. That go through once that book. You will get the basics. Okay, we are not having the fundamentals related to physiological aspect of the body. So once it is physiologically, we having the good knowledge, then we can build the further knowledge. Okay, we can develop the further knowledge. Okay, so Medhavah Srotas. Okay, there is this Ravanath Srotansi, all you know very well about this. Okay, so why I kept this slide just for revision, and along with that, Sravanaditi Rasadeva Poshyasya Sravanat. So you see here, nutrient substance are via the process of transduction to the path is called Srotas. So the nutrient substance are supplied to the each and every tissue. Okay, if the Medhava Srotas, okay, that Medhava Srotas is obstructed. So further all the dhatus related, if there is any Artava related, any Sukra related disease is there, any Artava related or Sukra related disease is there, in that we should think that if there is a Medho Vahasrotas, because of that Staulya people usually they'll get the PCOD and other gynecological diseases, they're usually they will develop. Okay, there is a late pregnancy. This all things happening because there is a Medho Vahasrotas obstructed or vitiated. So we should start treatment into this level, not directly giving treatment into the particular Artava related drugs. Okay, not only to that drugs we can give the we have to clear these channels and all. Okay, so we should use different drugs. I think in the Sarangadhara, there is Sarangadhara Prathama Bhaga, the 4th chapter, they told there is a Pramadi drug. Okay, what is Pramadi? What are the drugs? What is the definition of Pramadi? And what are the drugs they mentioned in this? We should go through once. Okay, after completed class, when we're having free, what is Pramadi? Okay, you go through once. I think you are by heart at the sloka, it's well and good. Okay, or else go through once. Okay, it's very important thing. Next, the color of Srotas. Okay, is very well-known thing. The Swadhatu, the particular color. Because of that, we are unable to see where the Medhava Srotas is present, where is the Mamsava Srotas is present. We are unable to see because it is in the same color and it is very small and very big. It's not visible to our eyes. Okay, so Srotas is not visible. And some Srotas we can see. Okay, Bahirmukha Srotas only we can see. Okay, Bahirmukha Srotas, there are 9 in number. That is maximum 7 are there in the Jatrurtha. Okay, that 7 is related to Shalakya. Remaining 2 are in the present in the Adobhaka of the body. Okay, so other than this Bahya Srotas, there are the classification given as there is a 13 according to Charaka and 11 pair according to Susruta. Okay, in this, okay, the red color what I given is it is not explained by both acharyas. Okay, no need to worry about all things. Now we will see only the Medhava Srotas. So both acharyas is told about Medas and they told Medas also, and Ashtanga they also given that Medhava Srotas. Okay. Okay, Vrukka, there is a Vapavaha. This is the Mula for the Medhava Srotas. Okay, Medas, it is Medho Dharakala present in different area. Medhava Srotas is present in the different area. Medas present in the different area. Okay, so just to be clarify that Medas is the Dhatu. Medas is the Dhatu. Okay, this Dhatus is present in the all the body in different areas they told. Okay, that Sukra is present in the Sarva Sarira, like that. Okay, that is different. And that Medho Dharakala, it is present in Udara. Okay, And Medavaha Srotas Vrukka and Vapavaha. Some Acharya they told that Kati and Vrukka also. Okay. And because of some deeds, we will get the vitiation of the Medava Srotas. Okay. How the Medava Srotas is vitiated? Charaka Vimana told that Avyayama. If the person is not doing proper exercise, that can lead to development of the diseases related to Medava Srotas. Now, in the Jatrurdva Vikaras, Avyayama, if the person is doing Avyayama, that can lead to some diseases. Diva Sopna, that can lead to some diseases. Diva Sopna also, it is given in Netraroga Nidana like that, okay? And Medanancha Atipakshanarth. If the person is taking Medo related food items, that also can lead to vitiate. Medo Vahani Dushyanti. And Varunyacha Atisevanarth. Okay, taking the Varuni Madhya. Okay, the Varuni Madhya Sevan also. I don't know actually what is Varuni Madhya. Don't ask me about Varuni Madhya. Okay, I not seen also. Okay, maybe somebody experts maybe seen that. I don't know. Because in Ayurveda, so many things are explained, but nobody is preparing or nobody is practicing that. That is a very big pathetic situation related to Ayurveda. Because Ayurveda is it's a very wonderful diet related system. Okay, so they given the different diet preparations, but we don't know what is what. Okay, so because of this, there is some diseases can develop. Ashtanindita Purusha. Okay, Ashtanindita Purusha. This is one of the common things can be observed. Ninditani Pramehanam. Prameha Pura Rupas also develop. Medava Srotas is vitiated. Okay, you see here, Ati Ashtanindita Purushaslo, Ati Dirga. The person is too tall. The person is too tall. What is the relation between Medo Srotas and along with Ati Dirga? Just remember, there is a Vata. The Vata Prakriti person people, they are too tall. Okay, so there is a Asti is vitiated. How Asti is vitiated, already I told you. Okay, there is a Dhatu Agni. Medo Dhatu Agni is not properly working. Asti Dhatu, okay, is not properly formed. Okay, so Asti and Ati Dirga, some relation is there. Ati Hraswa, there is also Dhatu Agni related. Ati Loma and Aloma. The hairs, okay, the hairs is properly formed in the skin, or there is no hairs, there is alopecia developed. Is also related to Medava Srotas. And Ati Krusha, Ati Gaurava. Ati Stula, Ati Krusha. All people they'll think that Ati Stula, Ati Krusha only related to Medas. Okay, and Prameha. Apart from this, you should remember these all things. Okay, even though it become late, I given that brief overview about all the Medas. Okay, before starting, it's not relevant to particularly Jatrurdhata Vikara. Just I am giving the brief about all the Medavasrotas and Medas related. Okay, because the basics are very important to build our career. Okay, so you know Prameha Pura Rupas. You see here Danta Talu Gala Jihva Mala Avruta. Next, these all are Mala Avrutas in the particular area. Dantamala. If there is a Dantamala is there, Dantamala is properly is accumulated. It is there with the Dantadavana, we can remove it. But excessively it is accumulated. Then it will convert into the tartar. Okay, so that is one disease developed in the Danta Rogas. There is a Danta Sarkara. Okay, Danta Sarkara one disease is there. Danta Sarkara is related to Medavasrotas. Next, there is a Talu, Gala, Jihva, Malas. Okay, there is a Kapha is accumulated in the Jihva and Medas is accumulated and there is a coating developed. There is a different diseases are developed. Okay, that are also related to Shalikya. And Astapada Daha, Mukha Madhuryata. Okay, the person is getting the sweet taste in the mouth. This also can be developed with Medavasroto Vikara. And This is the Samana Hetu. I think it's already completed by other speakers. So just I am leaving this all the things. Okay, you know very well. Ati pravrutti sangha siragrandi vimargamanam. This is the sroto dushti. This, okay, you remember these points. Okay, so many doctors, they're not seeing this in the practice. Ati pravrutti, whether which dosha Ati pravrutti is there, with dhatu Ati pravrutti is there, any sangha is there, okay, any vimarga gamana is present. Okay, rakta pitta, some diseases usually people they'll think rakta pitta is there. Rakta pitta is the vimarga gamanam is there, Ati pravrutti. Okay, some diseases only they are thinking about this. We should think this for the Shalika disease also. Okay, so any Ati pravrutti is there particularly. Okay, just now we saw there is a Dantamala Ati pravrutti. Dantamala Ati pravrutti, it can lead to disease development. So for each and every disease, when we see the Bhadiryam, there is a Sangam. Okay, there is a Sangha is the one of the Srotodushti. And Karna Nada is there. There is a Vimarga Gamanam, Sangam and Vimarga Gamanam. Okay, like that Srotodushti related things also we should be observed for each and every disease. Actually, Susruta is not given particularly this all things because already so many diseases are there. Okay, 250 diseases are there. Apart from this, again, he is telling each and everything. The people will get faint. For that, Susruta is not given. But we should analyze like that. If you are analyzing, then we can get the easy understanding of the Shastra. And so, apart from the Staulya and Prameha, other diseases, okay, Kushta, Switra, Masurika, Sleepada, Medodhatugata Jwaram, okay, Vatarakta, Shota, Uttara Roga. This all area also Medas is involved. Okay, if you see there is a Dushyas, okay, if you see the Dushyas in the particular disease, you can get so many areas Medas is there. Medas is a Dushyam. When we see the Prameha, in the Prameha, there is a Lasika is there, Medas is there, these all things are reached to the Vasti. And some areas only Susruta given or Charaka given that particular Dushya in the particular disease. Apart from that, some disease he not mentioned. Why he not mentioned? That is because the Shastra is become elaborated. If the Shastra is become elaborated and it will become bore. Okay, like my class. Okay, that also can happen. So for that purpose, they are usually skipping so many things. So, but we should be analyze ourselves and we should get the knowledge. And there is a, we observe Vriddhi Lakshanas are different, Rasa Lakshanas are different, and any Vidya Lakshanas are different. If any injury happened to the particular that Srotas, that can lead to development of different diseases. Okay, so you can see there is a dryness of Talu Shosha. Okay, there is a Talu Shosha, one disease is there. The Talu Shosha, it is also related to Medava Srotas. Okay, we covered, there are two diseases. One is the Danta Sarkara, second one is the Talu Shosha. And there is a, we observe Mukha Madhuryata, these all things are the symptoms. Okay, coming to the particular diseases, okay, when we see the modern aspect of this fatty deposits and all, we can observe the different diseases which is not particularly mentioned in Ayurveda. Okay, because according to Ayurveda, it is not a big disease and it is included in other group of the diseases also. Okay, in Ayurveda, it is not mentioned there is a Xanthosoma as a particular separate disease. Okay, it is not mentioned, but we can tell this as a Medovrutti. Okay, we can tell is some areas Medovrutti. Usually in the eyelids, the skin of the eyelid is very, very thin. Okay, usually there is no fatty deposits present in that particular area. Okay, and lips also, we can see the lips. and the tip of the penis and the root of the nail, okay, nail bed area. These areas there is no fat. Okay, in the palmar surface also little bit fat only present compared to other body parts. Okay, so in the eyelids, if the fat is deposited, that is easily visible, and is commonly we can observe this in the inner canthus area. Okay, commonly we can observe in the inner canthus, usually in the upper lid, then we can observe in the lower lid also. And it is a bilateral. Commonly, it is bilateral. Okay, both sides, right and left also can be observed. So the xanthosoma is nothing but it is a creamy yellow plaque like lesions which is frequently involved in the skin of the upper and lower lids in the inner canthus. Okay, this is happens because of the deposition of the lipids. Commonly, we can see this in the diabetes patients and high cholesterol levels. Okay, usually we'll go for the LDL levels and HDL levels and along with the triglyceride levels in these persons. Usually, we will notice that deposition. And sometimes I noticed xanthosoma in very lean persons also. Okay, the person is very lean, but there is a fatty deposit present in the eyelids. Okay, and that may be some other what we can tell like a vitiation. Okay, srotodrushti, medava srotodrushti may be happened in the particular. There is a kavaigunnata happened in that particular area that may be develop the disease. Okay, so this we can tell as a medovikara, and there is a dermoid cyst. Okay, this dermoid cyst usually we can observe in the forehead area and eyebrows. Okay, and temporal area of the eyebrows and center of the eyebrow. Okay, usually we can observe there is a fatty deposit. Usually this can happens and patient is having there is no pain. Patient is having there is no pain in the particular area. Okay, it is and it is a movable also and fluctuating, and the person is feeling that okay it is a some it is like a cosmetically abnormal. The person feels something is present because all the people they are asking, well, if it is anything is there in the face, all the people are questioning what is there in your eyes or what is there in the face like. Okay, so nothing will happen if it is there. Okay, if it is not operated also, nothing can happen. Okay, I failed to share you one video here. I think just wait, I will show you one video. I think I'm not able to share the screen. Okay, leave it. Okay, I failed to show you one case.
Okay, sir.
Okay, leave it. I will. Okay, we'll continue with the slides. Okay, so recently I saw one case related to this dermatologist, and it's very big and it's like elongated. Okay, it's elongated deposit of the fat present in the center of the eyebrow, and it is like a it is elongated, so it is covering the pupillary area. So once it is covered the pupillary area, he unable to see the objects. Okay, so he felt very difficult with that. So in that condition, we go for the procedure and we remove the fat from that, and we can cure that. Okay, or else with the medicines it's very difficult to treat it. And next disease is the lipodermoid. Okay, in this lipodermoid we can see there is a deposit present in the temporal, okay, temporal of the fornix area. Okay, so there is a solid tumor usually seen in the beneath of the conjunctiva. These are mostly located adjacent to the superior temporal quadrant of the globe. So actually it is also not mentioned in Ayurveda as a particular disease. Okay, lipodermoid is usually this is the lipid related abnormality we can observe. Usually we can do surgical excision and we can remove the content from that. Okay. So this is also one fat related abnormality. And tears. Usually we having the tear film contains 3 layers. The outer layer is the lipid layer. Okay. Outer layer is the lipid layer. Okay. Aqueous layer, mucin layer, lipid layer. Okay. 3 layers are there. In this, if there is a lipid layer, it is outer layer. Okay. Once the lipid layer is evaporated, then other two layers also get evaporated and I feel dry. Even though lipid layer evaporated, patient feels the dryness in the eyes. So this is also one thing. Okay, the dry eye. The dry eye also having some link with the Medovasrotas. Okay, so in that condition, usually the Susruta told that simple the Gruta Arshotana. Okay, simple Gruta Arshotana is enough. So he given the different Jivantyadi Gruta and other Grutas. Okay, the Gruta preparations also, other acharyas also told. But simple Gruta Arshotana is enough in the dry eye syndrome. Okay, so why the Gruta is adopted there? So that is nothing but there is a involvement of the Medas in the particular disease. And okay, in Ayurveda they told that there is they found the lipid is more easily absorbed from the eyeball. Okay, they noticed this point. For that only there is a Arshotana is there. Okay, different type of Gruta Arshotana also mentioned. Tarpana is there, Putapaka is there. Okay, these all are having the lipid substances and it's easily absorbed from the conjunctiva and limbal area and corneal surface. It can reach to the brain also. Okay, this is very, this is like a bypass. The medicine can directly reach to the brain. Okay, for that they mentioned the different type of the Grutas also. Okay, so this lipid or oily layer is formed from the secretions of the meibomian gland, G's gland, and mole gland. And this seborrheic dermatitis or squamous dermatitis, in this we can observe there is a glands of G's secretes abnormal excessive natural lipids which are split by the Corynebacterium again into the irrigating free fatty acid. Usually this meibomian glands, usually the meibomian glands which is present in the lid margin along with the G's glands which are secreting the lipids. So once it is accumulated, that also can cause the development of this. For that only Susruta told that in this Bedanam, we have to do the Bedana in this particular Krimi Grandhi disease. Okay, we have to do the Bedanam followed by the Lekanam also. Okay, small quantity, small extent of Lekana also have to do in the blepharitis condition. Next, Arcus senalis. This is also one of the fatty deposit present in the cornea. Okay, in Ayurveda we can tell this as a Avarana Sukla. Okay, one type of Avarana Sukla. Okay, there is no ulceration but opacity present. So Avarana Sukla we can take. Usually there is a arcus. There is a circular. Okay, it is a circular. You can see there in the picture. So many people they will think that it is as a cataract. Okay, this is the cataract like, but it's not a cataract. Okay, it is the arcus senalis. It will not harm anyone. The particular person will not get any visual disturbance with this because it is there in the periphery. Light is going inside through the people only. Sometimes, rarely, the side vision may get affected, but it's not a much affected in the visual field. So usually after 60 years, patients are getting 40 to 60 years. Usually after the 80 years, everybody is affected with this. So there is a lipid deposits present in the cornea, okay, that can form the arcus senialis. Okay, this arcus senialis, it is usually there are two types are there. There is arcus senialis, arcus juvenalis. Okay, arcus senialis usually develop in the after 60 years. Arcus juvenalis develop less than 40 years. And in this, commonly the oldest people are affected. African people are more common. And more cholesterol levels. Okay, when we check for the blood, we can observe the more lipids, cholesterol levels in there. Okay, and that is sometimes maybe there, sometimes may not be there also. Okay, in the lean persons also we can observe this arcus senialis. Sometimes it may not related with the blood cholesterol levels and the eye lipid deposition interlink. Okay, and it may be white or gray color and opaque, and it is a arc shape. Okay, circularly it is present. Okay, so it is usually developed in the circular fashion, gradually increasing the thickness. Okay, gradually increasing the thickness. It's not developed like a half of the cornea, not like that. Okay, totally it will develop and gradually it become thick in nature. So avarana shukla, you can tell like a avarana shukla. Next, lipid keratopathy. This is another type of the deposit. There is a some fatty deposit present in the corneal layers. Okay, there is a fatty degeneration of the cornea is characterized by the whitish or yellowish deposits. Okay, sometimes it is associated with the blood vessels. Okay, sometimes it is associated with the blood vessels also. Okay, there you can tell as a sira shukla. If it is associated with blood vessels, can tell as a sira shukla. Without that, we can tell as a avarana shukla. Okay, there is a cholesterol or fatty deposits was present. This leading to the opacification and decrease of the visual acuity. If it is there in the periphery, no problem. But once it is developed in the pupillary area, that can cause the visual abnormality. So this also avarana shukla like we can correlate. And retina and lipids. So usually the retina contains 10 layers. Okay, this 10 layers of the retina is divided into two. One is the neuroretina, another one is the RPE. Okay, this retinal pigment epithelium, this is one layer. Usually the retinal detachments happens like that only. Okay, separating the other 9 layers from the retinal pigment epithelium. Usually it will happens. Okay, so the retina is a part of the central nervous system together with the brain and spinal cord, and such also naturally is with the lipids. So it contains some portion of the lipids. Okay, what are the, for that only there is a interlink is there in between the tarpana. Okay, so tarpana, if you are doing the medicine will reach up to the retina because it is absorbed and it will reach to that and it will give the strength to the retina. Okay, so if any retinal abnormalities are there, if you need santarpana related treatment, we go for the tarpana. So in this, the other 9 layers, which is converted light stimulus into the electrical signals. That is the main function of the other 9 layers. And that information will go to the brain. So brain easily understanding what is retina is sending the information. Okay, like, so what is the function of the retinal pigment epithelium? This is the first layer. Okay, retinal pigment epithelium is the first layer of the retina. So the main function of this is to eliminate the metabolic debris generated by the photoreceptors. Photoreceptors are nothing but second layer, the rods and cones. Okay, so these rods and cones are eliminating some debris. That all things, the producing the debris, that is all eliminated by the RP. So once it is not eliminated properly, it will be deposited. So that may be expressed in the different form. Okay, one we can tell like a drusen. Okay, if there is a drusen formation is there, or diabetic retinopathy, or hypertensive retinopathy. Next, retinitis pigmentosa. Okay, sometimes retinitis pigmentosa. That retinitis pigmentosa also some deposits. Okay, that all things can be happen. We don't know exactly what is the cause for that and what is the treatment also. Till now, there is no treatment for the retinitis pigmentosa. So these lipids, the low density lipids are lodged in the retina that can develop the some diseases. So in that one particular disease is the ARMD or AMD. There is a age-related macular degeneration. Usually it can happens after the 70 years. Some books they given after 60 years, or some books they given after 80 years life. Usually in the old age. So it is a age-related deposit. Okay, age-related fatty deposit present in the retina. Okay, so that deposits usually present in the Bruch membrane. And okay, this drusen, what is drusen? The drusen is nothing but there is a multiple components included: lipofuscin, fibrillar and non-fibrillar amyloid, cholesterol, glycoproteins, zinc, all so many other things. So these all things are accumulated in the retina. Means the main function of the RPE is eliminating this. If RPE, retinal pigment epithelium, is not eliminating these lipid deposits, it will be accumulated and it form as a drusen. Okay, so depend upon that, it is two types. There is a dry ARMD and wet ARMD. Okay, ARMD means age-related macular degeneration. So what is hard drusen? You see here. Okay, as a Ayurveda doctor, okay, as a Ayurveda doctor, if you see this, what we can tell? Some articles which is written by the allopathy doctors. Okay, so there is a lipid. Okay, I checked in the internet like a lipid and lipid metabolism and eye abnormalities. Okay, I checked that these all things are there. So just I am collected for that only. I told that it is not a one simple one. It's very difficult to complete within a 1.5 hour. So it's a very elaborated topic. Okay, so just we can understand that what is there in Ayurveda, how as a Ayurveda doctor can understand the particular disease. So this hard exudates. Okay, this usually the macular degeneration, usually hard exudates will present throughout the retina. Okay, this exudates not only in the macular area, it present in the throughout the retina. But when we see the soft drusen, this is usually present around the macula. Just to see this picture carefully, where the drusen is present. I will show the next picture. Just notice this. Yeah, you see this. The soft drusen, it is very soft and it present around the macula predominantly. Okay, it present around the macula predominantly. Okay, so this is the age-related lesions. So because of that age-related, the person is getting the visual disturbance. They are unable to see the objects clearly. So Vardhakya, okay, when we see the Sarangadhara Samhita, with 60 years, okay, each every 10 years, the vitiation happens in the particular energy in the body. So eye energy, the energy of eye, the Shakti of the Drushti is reduced at the age of 60 years. Okay, so after that only we can develop that age-related cataract and macular degeneration, all other diseases. Okay, so dry macular degeneration, in this we can observe there is a photoreceptors on the RPE gradually failure of central vision. The person is not able to the central vision. I'll show the pictures, okay, related to this. Okay, it is more common compared to the wet. Okay, 90% of the people are suffering with means 90% of the ARMD people suffering with the dry ARMD. Okay, 10% only with the wet AMD. So in this, it happens when abnormal blood vessels behind the retina start to grow under the macula. So the new blood vessels, which is accumulated and it broken and leakages the fluid. So along with that drusen, some fluid also accumulated in the retina. So because of that, it can be considered as a wet AMD. So in the previous condition, in the dry AMD, there is no fluid accumulation. Okay, in this wet AMD, we can observe the fluid accumulation also. So for that, we can observe this as a wet AMD. Okay, so in loss of central vision also can happen quickly because macular area is more affected. Okay, I'll show the picture related to this, how the person is observing. Okay, this is the appearance. Okay, during that early stage of wet AMD, slight lines may appear wavy. The straight lines become wavy. Okay, you can observe the back side of the two kids. There is a the wooden thing is there. Okay, that back compound. You see in the next picture how it is. And the center of the two faces is clumsy. Okay, people with AMD also may develop the blind spot. Okay, which you can see there is a central vision affected in this. Okay, in this one simple test you can do. This is the Amsler grid test. So we'll tell the patient to concentrate on the center of the dot. If you tell the patient to observe in that, especially in the macular degeneration condition, we can observe there is the second picture like appearance. So wavy appearance of the lines. It's not a straight. So usually we'll do with the individual eye. Okay, we'll tell the patient close one eye and we should observe. Usually this AMD is the bilateral, not a unilateral. So if the person is observing with two eyes, sometimes it may be straight. So we will tell the person close one eye and examine with the individual eye. So this is the Amsler grid test. Next, coming to the diabetic retinopathy. So in this diabetic retinopathy, we can observe there is some exudates. These exudates also because of some lipid deposits. Okay, one study they told that there is a fatty deposits present in the retina can be considered as a exudates. Okay, there is a type of exudates can be noticed in this. So usually 4.8% of the people are suffering with diabetic retinopathy. So this is one of the common cause for the vision abnormality. When we reach to the 2040, so that time all people, maximum people are suffering with the diabetes. So many complications occur once the age is increasing. This more than after 5 years of the history of diabetes. Previously they're telling there is a 10 years history of the diabetes can cause the diabetic retinopathy. Chances are there like, but nowadays what happened with the 5 years of the history of diabetes also can cause the development of diabetic retinopathy. So main thing in the diabetic retinopathy is the lack of oxygen supply. Okay, repeatedly I am telling this point. Whenever I will tell about the diabetic retinopathy, I tell one point to remember. Lack of oxygen supply to the retina is one of the common cause for the development of diabetic retinopathy. So because of lack of oxygen supply, the retina needs more oxygen. Retina is thinking that the oxygen is getting from the blood vessels. Through blood only I am getting the oxygen. So I will start breaking the blood vessels. If I get the more blood, I'll get the more oxygen. So it start gulfing the blood, okay, that oxygen. For that purpose, this pericytes, okay, the pericytes become, there is a loss of the pericytes happen in the blood vessels to start the leakage. In the starting stage, microaneurysm happens. Small amount of the leakage of the blood is happens. Slowly, it is pulling, okay. There is accumulating continuously in that particular area. And later stages, it's break. That break may happen in the center area or periphery area of the retina also. So once the breakage happens in the blood vessels, blood is accumulated. Along with blood, okay, blood is accumulated as a hemorrhage. Along with the blood, some exudates also separated and it accumulated in particular area. So that is called as a exudates, okay, hard exudates or soft exudates. This is the normal appearance of the retina. Just to remember how it will be, through ophthalmoscope you can observe like this. The optic nerve and macula area. In the center of the macula is contains fovea, foveola and all. Okay, superior retinal artery, inferior retinal artery. These all things are usually seen. Okay. These are the risk factors, how the person is getting the diabetic retinopathy is worsen. Mainly metabolic factors. Okay, high glucose levels. Okay, and there is a low insulin taking, that also can lead, and that is vascular abnormalities, hypertension, obesity, smoking, alcohol. This all things, okay, can lead to the increasing of the VEGF. Okay, what is VEGF? Vascular endothelial growth factor. Once this vascular endothelial growth factor is more secreted, blood vessels started the proliferating. So once it is proliferated, more small capillaries are developed around the macula and around the optic disc areas and all. It can cause the proliferative diabetic retinopathy. So this all our VEGF is more accumulated, more secreted because of the diet and habits. So for that only in Ayurveda they told aharam viharam. Both are very important to prevent the disease. Okay, I already told 5 to 10 years. Usually floaters can be observed and dark empty areas in the vision can be noticed. And poor night vision. The person is not able to see the vision, especially in the night times. In the daytimes, he observes the patchy like. So because of this patchy like floating in front of eyes, he unable to concentrate in particular area. For that, repeatedly the person is blinking or rubbing the eyes, moving the head. Usually he will do like that. Okay, to remove the floaters in front of the eyes. Okay, it is not a small floaters. It is a patchy like. Okay, diabetic retinopathy, we can observe patchy like floating things. And the vision is fluctuating. Sometimes when there is a glucose levels are normal, vision is good, or else sometimes vision is worsen. So two types are there, NPDR and PDR, non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Okay, so once the fluid is accumulated gradually, it is, if the fluid is more accumulated in the macula, that can cause the diabetic macular edema. Okay, I will show you the next picture related to this easily understanding. You see in these pictures, in the first picture, we can observe there is a small red dots. Okay, and blood vessels area, you can observe there is a, I think, okay, now you can see here. You see the shape of the blood vessels. Okay, there is a knuckling, there is a bending is there. Okay, and narrowing areas. Okay, you can notice it's not a straight. So there is a blood is slowly escaping from the blood vessels, and it is accumulating in the different areas. You see in this next picture. Sorry. Okay, you see here in this picture. So from the blood vessels, blood is accumulated, and it is like a flame shape. Okay, two type of hemorrhage you can observe in the diabetic retinopathy. This type of hemorrhage is called as a flame shape hemorrhage. And some areas, small dots like appearance can be noticed. that is a dot blood sign. Okay, dot blood sign and flame shaped hemorrhage. And you can observe there is yellow color, white color, okay, some yellowish white color, some patches also in this. You can tell as a medas or caphum is accumulated in the retina. So as per allopathy system also, it is a lipid related abnormality. So you can see here, okay, two type of the hemorrhage can be noticed. If the borders of that exudates are clear, that can be considered as a hard exudates. If the borders are not clear and it is like a punchy, like a cotton, that can be told as a cotton wool spots. Okay, so there are two type of hemorrhage you can be noticed and two type of exudates. One is the dot blood sign. You can notice here so many dots in this first picture. Okay, so dot blood sign and flame shaped hemorrhage. This is the flame shaped hemorrhage you can observe, and the cotton wool spots, okay, near to the optic disc can be noticed. You can see the cotton wool spots. You can see the, okay, hard exudates also. Cotton wool spots and hard exudates in this. Okay. Now, this is the PDR, proliferative diabetic retinopathy. See, you can see here, you can notice there is so much of the small capillaries is proliferated. Okay, this proliferation also again two types, NVD, NVE. Okay, this is the NVD. NVD means neovascularization near the disc. Okay, neovascularization of the disc. Okay, optic disc. This is the optic disc we can observe in the first picture. Around the optic disc, so many small capillaries is noticed. And this is the NVE, means peripheral retina. Okay, peripheral retina contains so many small capillaries. So this is called NVE, neovascularization elsewhere. So diabetic retinopathy is two types. Okay, one is the NPDR, second one PDR. Okay, NPDR, PDR, again hard exudates, soft exudates, cotton wool spots, and you can observe there is a dot blood sign, flame shaped hemorrhage. Okay, and PDR two types. One is the NVD, another one is the NVE. So if there is a eye is not satisfied, what's the blood is coming? Okay, more blood vessels also form, getting the more oxygen, even though eye is not satisfied, gradually breaking of the blood vessels, finally accumulation of the blood. Okay, the leakage is continuous, and the leakage is mixing with vitreous. It can cause the vitreous hemorrhage. So once the vitreous hemorrhage is more predominant, person is getting the patchy type of the vision loss. So it is present in front of the retina. So person is getting the patchy type of the vision loss in this area. Okay. Then with what we can correlate? Okay, there are 6 patalas are there. There is Akshipatala and Vartma patala. In this, when we see the Tritiya patalagata timira, okay, Tejo jalasritam bhakyam, Teshwannat pishitasritam, Medaha Tritiya patalam asritam, Asti chaparam. Okay, we had one clue from allopathy system as there is a lipid deposits present in the retina can cause the development of the diabetic retinopathy. Okay, as per Ayurveda, they told Tejo jalasritam bhakyam. First patla Tejo jala. Second patla there is a Tejo jalasritam bhakyam, Teswannat pishitasritam. Okay, third patlam is Medo asrita patalam. Okay, the layer which is located near to the fat or medas. Tritiya patlam. Now we'll see the Medo asrita patala lakshanas. Medo asrita timira patala lakshanas. Okay, Tritiya patala timira lakshanas. Urdhvam pasyatin adasta Tritiyam patalangate. Mahantyapicha rupani chaditani vasa. Karnanasakshi yuktani viparitani vikshite. Yada doshancha rajyate tushtu dosham balayasi. Urdhvam pashyati na adastha. The person is not able to see the urdhvam pashyati. Upper portion he can able to see, lower portion he not able to see. Urdhvam pashyati na adastha trutiyam patalangate. Mahantyapicha rupani chadita nivasasa. You see here, the area is covered with cloth. Usually patients come and tell that some objects is covered with cloth like. Okay, it may be fully or it may be patchy like. We already noticed there is a patchy type of vision loss. Okay, so chadita niva vasasa. Okay, like this. In the diabetes, you can observe like this appearance. So it is nothing but there is a vitreous hemorrhage. Vitreous hemorrhage is present, or some amount of the hemorrhage is present in the retina area. Karna nasakshi yuktani viparitani vikshate. The persons are perceiving that karna nasakshi yuktani viparitani vikshate. If that means like if the eyes are there, this person is observing there is no eyes. Karna, nasa, akshi. These three things. If any person is not having these ears, but this patient is feeling that he having ears like. Okay, like perception can be noticed. So that is nothing but there is a accumulation of the some deposits. Next, adasthite samipastam durastam choparistitaha. So if the dosha present in lower portion, he unable to see the near objects. Durastam choparistitaha. Dosha present in upper portion, he unable to see the distance object. Parsvasthite tada dosha parsvasthani napashyati. Samantataka sthite dosha sankulani opashyati. If dosha present in one side, he unable to see that particular side. Means it is like a field vision defect. Maybe the patchy like vision, maybe it may be there. Samantataka sthite dosha sankulani opashyati. It is like a clumsy. ARMD we observe there is a clumsy like appearance. Samantataka sthite dosha sankulani opashyati. Sankula means it is like a clumsy, or it is like a what we can narrowing like. Next, drishti madhya gata dosha sayeva mannate dvita. If dosha present in center of the vision, objects are double like. Dvita sthite trida pashyet. Dosha present in two areas, he observing the three. Like a patch, okay? That patch is present, two patches are there. Then, okay, there is no patch area, and patchy area can be seen in the vision, no? So, if there is a two patches are there in the vision, he will observe other than the patch, one side normal appearance, patch appearance, normal appearance, patch appearance, again normal appearance, like that. Okay. So dvida sthitya trida pashyet. Bahuda anavasthitaha. If multiple patches are there, object is breaking like you can notice. Okay, just imaginary pictures I kept here. Adasthite samipastam durastam choparistitaha. If the dosha present in lower portion, the near objects is not able to see. If dosha present in the upper portion, he unable to see the other area. Parsvasthite tada dosha parsvasthani na pashyati. Sides he unable to see. Samantataka sthite dosha sankulani pashyati. Okay, like irregular like appearance can be noticed. Usually in the ARMD we can observe like this appearance. Drishti madhya. Okay, this is the patch like I told, no? See, there is one patch is there. So one side he observed clear, this side also clear. And he feel that object is divided like this too. Bahuda anavasthitaha. If the that mirror is broken, we okay, only one object can observe in that multiple law. Same like this, the person is observing the multiple objects. Okay. And so, but in Ayurveda, they're telling that there is no particular difference, there is a correlation for the diabetic retinopathy. In the Netra Prakashika, the Pujapada Muni, he told that there is a Madhumeha Upatrava. Okay, there is one complication he given. Okay, but we can tell this as a Tritiya Patlagata Timiram. So these all are the single drugs. Usually it will work in the diabetes very effectively, and Chakshusha property also there for these drugs. Okay, Amlaki also having Chakshusha, Haritaki, Vibhitaki, Lotra, Vasa, This Vasa is the one of the best for controlling the leakage of blood, and Lodra having that reformation of the blood vessels. Okay, proper healthy formation can happen. And Kiratikta to stop the further bleeding. Guduchi also stop the further bleeding, and Rasayana property is there, and Haridra Nishamlaki preparation is there, that is very effective. And Meshashrungi also stop the that further damage of the blood vessels. And Chakshusha property is there for this, and Prameha Hara and Chakshusha. So the Malabar nut Vasa is, you know very well. So because of time being, I'm going very fastly. You know this Amlaki. So this is one of the best Chakshusha Dravyam, and this Vayastapana also. Okay, it stopped the age that here that age related abnormalities happening. So the age growing that can be stopped with this Amlaki taking. So antioxidant property is there for this. And omega-3 fatty acids. Why I kept this slide? You observe this carefully. A person's, actually it is collected from one article, from modern article only. A person's dietary intake and balance of omega-6 and omega-3 fatty acid has been reported to be important for the regulating vascular activity. So we have to take that omega-3 fatty acids and omega-6 fatty acids, and mediating immune and nervous system function, and influencing the balancing of systemic lipid derived mediators. So we have to take omega-3 and omega-6 fatty acids, okay, for the proper healthy vision. But see, long back, 2000 years back itself, our acharyas, they told, he's telling that you should take daily grutam. Okay, gruta taking, trifala taking, this all are told. Ashwatana taking, tarpana taking. These all are, we are giving the lipids in the different form, directly to the eyes and orally also. So same thing, now only people are understanding what it is there explained in Ayurveda. So like this, okay, Tarpana, Potapaka, Ashwatana, we are doing the lipid substance directly to the eyes and internally also. And some Lekana procedure is very important in the accumulation of some abnormal thing. Okay, like when we see that Vartmagata Vikaras, okay, Lekana we have to do. To remove the Medas, Lekana is one of the best treatment. Okay, so 9 diseases they told, maybe that Medo involvement present in that disease also, I think so. Okay, Jalukaucharna, Nasya, Sirodhara, and Virechana. These all are procedures is very good in the Medo Vikaras. And especially that Pindi Vidalakam. Okay, and Punarnava also very good to regenerate the healthy tissue. Okay, you see, this is the track we should, and this is advised by the allopathy doctors for the diabetic persons. In this, the pranayama, I told one point, diabetic retinopathy usually occurs because of the lack of oxygen supply. If you do the pranayama properly, proper oxygen reach to the all the body parts, and have to control the stress and all. Okay, next, coming to the other diseases. Okay, in the ENT diseases, okay, few more slides are there. Eye related diseases and along with more, and very few ENT related diseases we notice. In the Osteroga, there are 8 types of Osterogas. In that, Medaja Osteroga, okay, one type is there, Medaja Osteroga. So it is directly told that Medas is involved in that Osteroga. Sarpirmanda Pratikasho. It is like a Grutamanda, like shining of the lips can be noticed. Medasa Kandurau Mrudu. Person is getting the more reaching sensation and lips are so soft. And Swachha Svatikam Sankasham Asravam Sravet Brusham. And spatikam, how that alam is there, like that appearance can be noticed in the lips. Okay, it is a Medaja Ostaroga. There is a direct reference is there for this disease. So Medas involvement is present in this Medaja Ostaroga. So treatment is that in this, the Raktamokshanam is very important. You are telling that it is a Medas related disease. Why you are doing the Raktamokshana in this? Because the fat is, already I told you, the blood vessels, sira is the one of the, it is formed from Medas. So the fat is circulating through the blood vessels. Along with blood only, it is going. So if you are doing that Raktamokshana, what is the accumulated blood is there, accumulated fat is there in that particular area, all are eliminated. Dushat Rakta is eliminated and healthy tissue will form once the healthy blood is reaching to that area. For that only our acharyas, they told not only the local treatment, internal medicines also they advise. Next, Sweda Karma, very effective. And gargling also very important, because gargling, if you do the Kavala Gandusha, that will remove the accumulation of the kapha and in the oral cavity. And you see there is a Priyangu Trifala Lotra Sakshotram Pratisaranam. We have to apply externally Priyangu Trifala Lotra. Okay, along with Ani. See this yoga, Bhava Prakasha told that Priyangu Trifala Lotra Sakshotram Pratisaranam. Okay, these three things we should apply with the Madhu. In Chakradatta, what he told, the Priyangu Trifala Lotra mixed with honey or Tripala powder with honey only can be applied. Okay, so Sweda Karma is very effective in this. And he told Medaje Svedite Binne Shodite Jwalano Hitaha. He told Agni Karma also. Okay, when we see the Agni Karma, because of that, how the Agni Karma is working in this. If you apply heat, the medas become liquefied. Okay, and the damaged tissue is removed, and after that healthy tissue will form. So have to do. Next, Talu Pupputa. Okay, this also for direct reference is there. Kolaba Sleshma Medobhyam. Okay, Pupputo Nirujo Stiraha. Kolaba Sleshma Medobhyam. This also because of the Medas involvement is there in this. Okay, so Talu Pupputa, it is like actually the Pupputa is nothing but it is like a fruit, cola fruit like. There is a Danta Pupputa is there, Talu Pupputa is there. Okay, so both are looks like a fruit of Jujubas. So in this also Lekana Karma is very effective and Kavala Gandushas are very effective. When we see the Galaganda, okay, Galaganda also there is a Vata, Kapha, Medas involvement present. Okay, so Vata, Kapha, Medas, Galaganda. And Muskaval Labate Atiruk. It is a hanging. Okay, it is hanging like a scrotum or testis. Okay, so another reference, this also same thing. There is a kapha involvement. Okay, there is a and Galaganda also. Again, one type they especially mentioned as Medaja Galaganda. Okay, already Galaganda is involvement of Medas present. If Medas is more, it can cause the development of the Medaja Galaganda. And Gandamala also. Karkendu Kola Amalaka Pramanav. Kaksham Samanya Galavankshnayo. Medaha Kafabhyam. Okay, Medas involvement is there and Kapha involvement. So Gandamala also Medo involvement. This also Chaturtagata Vikaram. So in this treatment, what we have to do? We have to eliminate the Medas from that. And Karna Arbuda, Medoja Arbuda. Okay, actually when we see there is Arbuda, Arses, Sofa, there is a Samana Lakshanas they mentioned. So one type is the Meda Arbuda. Karna Arbuda, Meda Arbuda is there, and Nasa Meda Arbuda also is there. So Samana Lakshanas can be observed. So this is the reference from Chakradatta. There is a Varunadi Gana is very effective in the Medo Vikaras. So Varunadi Gana effective in the Kafaja and Medo Vikaras. Sirasulahara, Gulmahara, and Abhyantara Vidridihara. So in the Abhyantara Vidridhi, the best drug is the Varuna. Okay. So this can be given. Along with this, there is a Kanchana Gugulu and Gugulu Medo Anlaharana. So all type of Gugulus, especially the Purana Gugulu, having the Lekana property. And Maha Mayura Grutam also having the special reference in the Medas. Okay. And it is a, actually it is a Medakara. What is Medakara? Medakara means it increases the healthy brain tissue. Okay, Mahamayura Gruta is good in that. Okay, you know very well about Arbuda types and all. So I'm not telling in detail about each and everything. Okay, I have to mention one point here. Ashtaveda Shastra Karmas. In the Ashtaveda Shastra Karmas, they told Danta Vaidarbha of Medaja origin. Medaja Grandhi. Actually, Danta Vaidarbha of the Medaja. Okay, actually, when we see the classification of Dantamolagata Rogas and all, they not mention like Kapha involvement, Medas involvement in this. But the Susruta told that Danta Vaidarbha of Meda origin and Medaja Grandhis and Medaja Vartma. You see here, okay, when there is first we observe there is a, we notice the Xantholesma. Okay, we can take this as a Xantholesma. But in the classification of Vartmagata Roga, 21 type of Vartmagata Rogas, he not mentioned. Okay, but here you can see Medaja Vartma Vikara. So this Medaja Vartma Vikaras can take as a Xantholesma. There we can do the Lekana Karma. Okay, with the Mandalagra, okay, other thing. And Vyayama Udvartana treatments are also very effective. Some single drugs like Haridra, Gugulu, Trikatu, Trifala, Aragvada, Karave, okay, Karavira, Karavelaka also. Karavelaka is nothing but bitter gourd. Okay, Karavira is the Nerium. And Trivrut and Trikatu is one of the best drug. You remember this point, Trikatu Churna. Okay, Trikatu Churna with Madhu. It's very effective in the Medaja Vikaras. Okay, if the person, healthy person also, if you're taking that Trikatu Churna daily, that he can prevent the Medaja Vikaras. But people is there, should not use the long days. And Medoharam, Tankanam is very effective. The compound drugs, you know very well, Aragivardhini, okay, Trifala Gugulu, Navaka Gugulu. Navaka Gugulu, especially it is mentioned in the Medo Vikaras. Okay, I think it's become late. So this is the healthy diet. I think already it's covered from other presenters. And if you take the Madhura Rasam continuously, so that will cause the increasing the Medas. So you have to avoid the more taking of Madhura Rasa. But Madhu is Medoharam. Okay, Madhu is Medoharam. For Stula, we can use it, reduce the weight. If you use in the Krusha patient, it increase the weight. Madhu having that property. Okay, it is also indicated in Madhumeh also. Okay, this is the last slide. You can see the Mulaka Yusham. Okay, soup of radish. This soup of the radish also, it reduce the kapha and medas. So we can tell the patient, okay, that is especially the Bala Molakam. It's very important, not the fully ripened radish. Okay, so this is the common thing. So in this class for that only, it's not possible to cover all the Meda Vikara. Okay, when I taken the topic, it's very small topic like I felt. Once I started working, is a elaborated topic, so it's not possible to complete it in a particular time. Okay, so any doubts you can ask.
Thank you
Thank
very
you.
much, sir. Yes, sir. Thank you, sir. Thank you for such an enlightening session on Jatrudri Meduvaha Viharas. We will now go ahead to the question and answer session, sir. Shall we begin, sir?
Yes.
Yes. I request all the participants to raise the questions in the discussion panel. I request all the delegates to post your doubts in the discussion panel. Sir, I think, sir, there's a question, sir. May I read it out, sir? So
Yes.
please tell about Medo Agni correction medicines, sir.
Yeah. Medo Agni correction. First of all, how the actually Agni Vardakas, okay, all the Agni Vardakas which all are working in the Jataragni, that will work in the Dhatu Agni also. Okay, there is no particular thing, but once we can see there is a particularly which all are drugs is indicated in Medo Vikaras, like a Gugulu. Okay, you will see that list of the drugs which all are working in the Medas and which all are having the Deepana Pachana property. Almost all the drugs all having the Deepana Pachana. So Medohara, Deepana Pachana drugs all are working in the Medo Dhatu Agni. Okay, so you see Chitraka also Medoharam and Agni Deepanam, Gugulu, Haridra. Okay, these all are working on the both. Okay, so that, but no, knowingly or unknowingly, they implemented. Okay, they implemented Ayurveda Acharyas. They implemented the particular drugs is working. Means we are knowingly or unknowingly we are using same drugs. So it's very effective in the both the conditions. So nothing to worry about. There is no particular Medo Dhatu Agni related drugs. So which all are working in the Medo Vikara, that all are having the Deepana Pachana property. They are Deepana, Agni Deepana. Okay, it's working on the Medo Dhatus.
Thank you, sir. I think that's all for the questions, sir. Shall we wind up the session, sir?
Yes. Thank you and all.
Yes. Thank you very much, sir. It was really an informative session for our clinical practice, and we are very lucky to have you in our platform, sir. Thank you for taking the class patiently, even in your ill health, sir. Thank you all the participants for patient listening and coming up with doubts. Our next session will be commencing right shortly. I request all the delegates to stand by. Thank you so much, sir.
Thank you.
Thank you, sir. Good evening, sir. Welcome to DIKSHA Academy, sir. Am I audible to you, sir?
Yes, myself, Dr. Prasanna. Right.
Yes, sir. Yes, sir. Shall we start the session, sir?
Sure. And I may require some assistance to display
Sir,
my presentation.
Okay, sir. So, can you try it from your side, sir? Screen sharing.
I forgot because I did 2 years before and I forgot.
Sir, we'll have a try.
Screen share, right? This is
yes,
one.
yes,
that which one I should, multiple participants can share simultaneously, or which one participant can share at a time, right?
Yes, sir. One participant at a time, sir.
Right. It is there. Done.
Okay, sir.
Done.
Yes.
Thank you.
Yes, sir. Thank you, sir. It is visible, sir. It is not full screen yet, sir.
Is it now?
Yes, sir. It is full screen, sir. Shall we start the session, sir?
Sure. Okay.
Yes. Once again, welcome back to AyurCon 2022. Now, I would like to welcome Dr. Prasanna Mogassel, sir, with us to discuss on the topic, Perplexities of Prameha and Parallel Perspective. Dr. Prasanna Mogassel graduated from STM Udupi, being chiseled from eminent Ayurveda persona, Dr. G. Srinivas Acharya, sir, who was inspiration for his Ayurveda life. Dr. Mogassel went to Government College, Mysore for his post-graduation in Kaya Chikitsa. He then joined his mother institution and worked relentlessly for more than 20 years. He is very popular for his teaching skills, clinical practice, PG guidance, and of late being eloquent speaker in Ayurveda Forum. His deep knowledge in Ayurveda Samhita and also parallel expertise in modern medicine has brought new dimensions in understanding Roga Nidana in new perspective. His talk can change the approach towards the disease and disease condition. His talks on Mutravaha Sroto Dushti, Shula Roga, Prameha, Grahini, Dushivisha, Garavisha in iconic places like All India Institute of Ayurveda, Kottakkal Ayurveda College, Parul University, STM institutions, etc., have received massive appreciation. With the blessings of Almighty and his teachers, and with his loving students, and with very charismatic personality, Dr. Prasanna is working as Associate Professor, Head of Department, PG Guide for Roga Nidana and Vikriti Vijnana in STM Ayurveda Medical College, Udupi. Now, without any further ado, we will turn the time over to respected Dr. Prasanna Mogassel to enlighten our minds. Over to you, sir.
Thank you. Namaste, one and all. We all gathered here today on this auspicious day of Deepavali. I pray Lord Dhanvantari to fill the lights of knowledge and lit the lamp of Deepavali, light up every step we move. At the outset, I would like to thank DIKSHA Academy affiliated to AVP Coimbatore, and I would like to extend my thanks to Dr. Nisha Kumari for introducing me to DIKSHA Academy. Let me begin the talk. So today's topic is Perplexities of Prameha and Parallel Perspective. Right. Ayurveda believes microcosm and macrocosm analogy because it is originated from the Hindu system where Loka Purusha Samya is accepted. And microcosm is understood by the macrocosm. That is what nowadays we say physics and chemistry. Loka Purusha Samya is related with the physics and chemistry, and it is not mere only that appearance. And one such principle is solution. What is a solution? When a solute is dissolved in a solvent, that becomes a solution. And the solution, if you add some more solute, there will be a saturation. There will be a saturation. If you add little more, then the solute will not be dissolved. Solute will not be dissolved. And hence you require more and more amount of solvent to dissolve this solute. So that is the analogy, that is the relation between this principle of physics, solute and solvent becoming solution. That is the principle behind the Prameha disease. Samanya lakshanataya tesham prabhuta avila mutrata. So here, avilata refers to mala. Avilam samalam. Tatra avilatvam mutrasya prameha dushanam medo raktam mamsa majja shukra udaka vasa lasika ojasam pachideva pramehe pachidevas kasajideva dushasya avayava mishri bhavan. Now here the udaka is the solvent, and the medo, rakta, mamsa, majja, shukra, vasa, lasika, ojas, all these are solutes. So whenever there is excess of solutes, then naturally requires excess of drava or dusha, that drava or the udaka. So that's what it is said in the commentary. Tesham evacha dushanam draver ekibhutatvat mutra prabhutattvam. So excess of solute and excess of solvent. Excess of solute, abadda dhatus, and excess of solvent, udaka, sharirada drava, or the kleda. So that is the principle behind the disease prameha. With this background, let me move on to next slide. As we all know, prameha is medo pradashij vikara. And the medo ashwatas, vrakka is the mula, vapavahana is also the mula. Vrakka, I do consider it as the adrenals. Adrenal gland produces hormone that helps regulate metabolism, immune system, blood pressure, response to stress, and other essential functions. And vapavahana is considered as udarastha snigdhavartika by the Chakrapani. So udarastha snigdhavartika refers to pancreas. The pancreas is a heterocline gland functioning as exocrine gland. The pancreas excretes enzymes to break down the proteins, lipids, carbohydrates, and nucleic acids in the food. Functioning as endocrine gland, the pancreas secretes the hormone, insulin, and glucagon to control the blood sugar levels throughout the day. And there is an interesting description in Ashtanga, Vagbhata, senior and junior Vagbhata. That is, they explained this particular disease, prameha, in relation with the basti and the mutrava vikara. So adomukho api bastirhi mutravahi siramukhe parshvebhya puryate sukshme sandamane ranaratha estereva pravishyena dosha kurvanti vimshatim mutragatan pramehascha krichran marma samashrayan. So this is a description where mutragata and prameha are told in relation with the basti. Of course, every samprapti told by Charaka, Sushruti, once again the basti, the description of basti is there. Without basti description, the samprapti is incomplete in Charaka or Sushruta. Whereas Vagbhata highlighted prameha and mutragata together. As per Vagbhata, there are 20 types of mutragata. So out of which 12 are mutragata told by Sushruta or Charaka, and remaining 8, in among the 8, the 4 are mutra krichra, that is doshaja mutra krichra only, and another 4 are ashmari. Collectively, he called it as mutragata, whereas in Charaka, the mutragata are called as mutra dosha. He did not mention it as mutragata, rather he called it as mutra dosha. And mutra krichra are separately mentioned. Ashmari description is also there in Charaka. Sushruta, mutra krichra, mutragata, there is a difference. Similarly, the ashmari is also there. Whereas in Vagbhata, altogether 20 mutragata and 20 prameha. And these two are characterized by the alpa or bahu pravritti of mutra. So alpa pravritti of mutra, that is 20 mutragata, and bahu pravritti or prabhuta mutrata, that is a characteristic feature of 20 prameha. And this particular description looks like the cardinal feature of the disease, that is the prabhuta avila mutrata. It is not only that, it also signifies the pathological events in the system. And as we all know, prameha, generally we teach, we classify like stula pramehi, krisha pramehi. And we also classify prameha like sahaja prameha, apatya nimittaja prameha, and the different characteristics related with the sahaja prameha, apatya nimittaja, which we all know. And it is also said that sahaja prameha is mostly krisha pramehi, and apatya nimittaja prameha is nothing but stula pramehi. And apart from this, there is an interesting description in Charaka Samhita. Apart from all this classification, there is an interesting description that is told by Charaka, especially in the Chikitsasthana, while mentioning the sadhya cells of disease prameha. So description goes like this: Sa purva rupa kapha pitta meha pramena ye vatakritascha meha sadhya na te pittakritastu yapya sadhyastu medo yadina pradushtha. This particular description, Sa purva rupa kapha pitta meha sadhya na te, that is very interesting description, wherein he says general understanding of prameha kapha sadhya, kaphaja prameha is sadhya, pittaja prameha is yapya, whereas Charaka says Sa purva rupa kapha pitta meda sadhya nate. That means there is one understanding in the Samhita, that is Sa purva rupa prameha and apurva rupa prameha. And the Chakrapani commenting on this, he says tatra kafameha sadhya uktaste pura rupena saha vartamana asadhya bhavanti pittameha yapya uktaste pratyakeya bhavanti. It is said kafaja is sadhya, but if it is sa pura rupa, it is asadhya. Similarly, pittajameha is yapya. Though it is yapya, if sa pura rupa, then it becomes pratyakeya. And this particular description is further, there is some clarification. When we have studied the sadhya of every disease, there are some certain principles which are common for all diseases. If all pururupa are present, in a disease, then disease is asadhya. And if alpa pururupa, then disease is sadhya. Then what is this description? Sa pururupa prameha is asadhya. The Chakrapani clarifies, he says, Tatra sa sarva pururupa anupando sarva roganam sadhyatvam muktam ihatu asamasta pururupa anubande api asadhyatvam bhavati iti vishesha vachanat labdhyate. So that is in all diseases, it is, if the disease is asadhya for management, that means there generally the pururupas, all pururupas will be there. Whereas in case of prameha, if a minimum pururupa, 1 or 2 pururupa, if it is present with the samanya lakshana, then also it is asadhya. That is a speciality of prameha sadhyata. Further, Chakrapani clarifies, pura rupa rahityena pittakrite pramehe kadachit sadhyatvam iti bhavati apavada vidim darshayitum. Of course, kafaja is anyway sadhya, but pittaja is considered as yapya. But if there is no pururupa, though it is yapya, it becomes sadhya. It is apavada. It is an exception. So, with this description of Charaka and Chakrapani, it is very clear that there is another classification, that is sapururupa prameha and apururupa prameha. Further in the description of Charaka, he said, sadhyastu medo yadina pradustha. The same description, sapururupa kafapitta meha, the same context, he ends that shloka, sadhyastu medo yadina pradustha. That means, adusta medaha paitikaha sadhya bhavati iti artha, kimha pradusta kafapitta mehastavad asadhya. So with this particular description, once again, 2 more classifications. That is adusta meda prameha and pradusta meda prameha. And adusta meda prameha is sadhya. The pittaja meha is generally yapya, but adusta meda paitika prameha is sadhya. And kimva pradusta kafapitta meha astavad asadhya. The kafaja prameha is sadhya, pittaja is yapya. Though it is sadhya, yapya, whatever it is, if there is medadushti, then once again this particular condition is asadhya. And further, it is concluded that kimva pradusta kafapitta mehas tavat asadhya tata sapururupa santo asadhya bhavanti. So with this he says adusta meda prameha is nothing but apururupa prameha. Pradusta meda prameha is sapururupa prameha. So though there are 2 classifications based on meda, another is based on pururupa, both are nothing but the same issue. Adusta meda prameha is nothing but Apururupa. Pradushta Meda Prameha is Sapururupa Prameha. Now, all about Dushta Meda, all about Dushta Meda. So whether Adushta or Pradushta, that matters. So when we look into the Pururupa, when we look into the Pururupa, where it is said that Jatili Bhavam Keshishu Madhuryam Masasya Karapadayo Suptadaho Mukha Talu Kanta Shosham Vipasam Alasyam Malam Kaye Kaya Chidreshu Upadeham Paridaham Suptatacha Angeshu. This all we know. And here in this particular slide, I have highlighted few symptoms. These are definitely suggestive of Pradushta Meda Prameha. Pradushta Meda Prameha. In the absence of these features, in the Pururupa Avastha, in the Pururupa, we need to consider it as Adushta Meda Prameha clinically. And how to understand this particular Adushta Meda Prameha without Meda Dushti? It is very difficult because all these days we have understood Medo Pradoshvikar. Prameha is Medo Pradoshvikar. So there is an interesting description. So the article says, in the early stages of the illness, the ground filtration rate is reduced, but not to the level below 30 to 50% of the normal. The patient is either asymptomatic or complains only of generalized weakness. The clinical examination or investigation do not reveal any significant abnormality. The patient is prescribed some tonics and his symptoms are often dubbed as functional. On direct interrogation, at this time, many patients will come out with a history of nocturia, which is one of the earliest manifestations of chronic renal failure and often ignored by the patient as well as by the physician. Nocturia and polyuria are more likely to be early features of renal disease that predominantly affect the medulla, and in such conditions may be accompanied by hyposthenuria rather than isostenuria. Hyposthenuria, when carefully looked for, is a common feature of chronic renal failure irrespective of underlying disease. So this is Adushta Meda Prameha. That's what Vagbhata. She said, Ado Mukho api bastirhi mutravahi sira mukhe parshvedbhiha puryate sukshmi sandamane ranaratha. So this is the understanding. Basically, this particular concept is proposed by Charaka, and which is much elaborated by giving this particular reference by Vagbhata. Now, moving on to Pradushta Meda Prameha or Sapururupa Prameha. So, Pradushta Meda Prameha, nothing but Sapururupa Prameha. Generally, whenever we speak Prameha, Prameha is Sahaja and Apatya Nimittaja. Sahaja is Krisha Pramehi, Apatya Nimittaja is Stula Pramehi. Of course, now Sahaja Prameha. Of course, Sahaja Prameha or Krisha Pramehi, this is even applicable for Adushta Meda Prameha also, but for convenience, I added under this classification, but this is applicable for Adushta Meda as well as Pradushta Meda. Both the area, this is applicable. So let us study Sahaja Prameha or Krisha Pramehi. So we know that Sahaja Prameha, that is Tatra Sahajo Mata Pitra Bida Dosha Kratha. Mata Pitra Bija Dosha Kratha, that is Bija Dosha is responsible for Sahaja Prameha, generally emaciated, Dhatukshaya is observed, not food craving and active compared to the other. The person is lazy there, whereas here active, and in case of Krisha Pramehi is not food craving, whereas the Apatya Nimittaja food craving person. So all this description which we know. Moving on to next slide. So Bija Dosha refers to Sahi Bija Dosha Aditi Prameharambaka Dosha Dusta Bija Jata Pramihitvat. That is Prameharambaka Dosha in the parents or the grandparents. Sahaja is all about Shukrartava Dosha, Doshanvaya. That is Matrija, Pitrija we have studied. Or it is also said Kulaja iti Pitra Pitamaha di Karanudbudha. So the history we need to reach up to Pitamaha also. That is grandparents also. That is Bija Dushti by Prameharambaka Dosha in the parents or grandparents. And how this Prameharambaka Dosha results in Bija Dushti. And where exactly? What is the mechanism? We know that Bija, that is ultimately Garbha, Bija from the Bija, the Garbha is formed. And we know that Garbha is made up of 6 factors: Matraja Bhava, Pitraja Bhava, Atmaja Bhava, Sattvaja Bhava, Satmaja Bhava. Like this, we know that 6 factors responsible for Garbha. And here, one such factor is Satmaja Bhava. Why 6 factors is required for Garbha? It is very clear, because all these 6 factors having different functions. And one such bhava, that is Satmaja Bhava. Satmaja Bhava is responsible for Arogya. It is said that Satmajam cha ayam garbha. And the functions are said: Tadyata arogyam, analasyam, alolupatvam, indriya prasadaha, swara varna bija sampat, praharsha bhujastvam cheti satmajane. This is Charaka Sharira. That is what Arogya, the health of an individual, depends upon the genetic factor, that is Satmaja Bhava, which he carries from by birth only. Okay, and that is, it is responsible for this Satmaja Bhava in the Garbha, that is responsible for Bija Sampat. So that is the thing. So Prameya Harambaka dosha affects Satmaja Bhava, thereby the Prameha is seen in the progeny. And we know that Bija, we know, everybody knows Tatru Uchate Yasya Yasya Angavayavasya Bija Bhagaha Upatapto Bhavati Tasya Tasya Angavayavasya Vikriti Upajayate No Upajayate Cha Anupatapat. This description we know. And once again, I place this slide because I want to give some clarity and with the commentary, that is Bija iti Shukra Shonita. What is this Bija? Bija is nothing but Shukra Shonita. Shukra Shonita is Bija. And this particular Bija, which holds the Bija Bhaga, that is very clearly told by Chakrapani, Manushya Bijam hi Pratyanga Bija Bhaga Samudayatmakam. It holds Bija Bhaga. Bija Bhaga represents different Anga Avayava in the Sharira. So Bija holds Bija Bhaga. Further, it is said that Bijasya Anga Pratyanga Nivartako Bhaga Bija Bhaga. Bija Bhaga, the factor which is responsible for different Anga Pratyanga. Hence, Bija is responsible for its replicate or offspring, health or disease also. Once again, with the replicate, that is health or the disease also, that is normalcy and abnormalcy of an avayava depends upon Bija Bhaga. It is nothing but Bija itself. So this is about Sahaja. Why a person, why a progeny, why a child gets this particular disease, why he should suffer, why a child should suffer, why the progeny, then next generation should suffer from this particular illness. And it is very clearly said in Samhita, and the philosophy says it is all about karma. So it is very clearly told by Charaka in the chapter Arshas, that is Charaka Chikitsa 14, where he says Tatra Dvido Bijopatapto Hetuhu Mata Pitror Apacharaha Purvakatam Chakarma. So there are two reasons for Bijopagata. One is Mata Pitro Pacharaha. Another is Purvakatam Chakarma. So what are these? What is Purvakatam Chakarma? He says Purvakatam Chakarma iti Jayamanasya Sahajarsho Abhinirvartakam Janmantariya Karma. So now a person is suffering from an illness, and that illness is innate for him. See, he has developed from family. And why? Because his Janmantariya Karma. He has done a lot of sins in his previous life that has resulted in one disease, Arsha or Prameya, or any other disease. Now, why and how? He says, Tacha Karmam Durbalam San Mata Pitra Apachara Sahitam Bijadushakam Bhavati. He says, Chakrapani says, Tacha Karmam Durbalam. If an individual has committed minimum sins in his past life, but for his sins he need to suffer. And that when the person dies, the Atma along with the Ativayika Purusha will search such a womb where parents are practicing faulty food and lifestyle. Parents are practicing faulty food and lifestyle. In such womb, this particular Ativayika Purusha will enter, and the child will suffer from the illness. And this particular illness is because of his past sins, past life sins. And further, Chakrapani says, Balavatu vina apachara janakameva bhavati tinyayam. When his sins are too much, he has committed a lot of sins in his previous life. And in such occasion, he may take a birth in a family where the disease is not at all existing, but the child, that the individual will suffer from the illness. And this particular description is eye-opening description. The Tacha Karamam Durbalam San Mata Pitra Apachara Saitam Biedushakam refers to genetic disorder wherein you will get a family history, where parents are suffering from the illness or the grandparents are suffering from the illness. And another description, Balavattu Vina Apachara Janakameva Bhavatiti Jnayam, refers to new disease, that is mutation. The disease which was not existing in the family has appeared in the family, that is mutation. So the genetic disorders and mutation, the concept, fundamentals of genetic disorders and mutation is explained in the context of Arsha in Charaka Samhita. So this is the reason why an individual should suffer from Sahaja Prameya, because it is his karma. And how to understand that family history, the parents or grandparents. So that is Sahaja. Sahaja is applicable, Sahaja Prameya is applicable for, that is for Apururupa or Sapururupa or Adushta Meda or Sadushta Meda. Both the occasion it is applicable, whereas Apatya Nimittaja Prameya, this is probably referring to the Pradushta Meda. And now we know that Tridosha Upanimitta Vimshati Prameha Bhavanti Vikarascha Vikasha Pare Aparisankhya. We know that Tridosha are responsible for all types of Prameha. And we say Vataja Prameha, Pittaja Prameha, Kapha Prameha, that is based on Dosha Dikyata, that is Tridosha Upanimitta iti Sarva Prameheshu Tridosha Karanam Adikatvacha Sleshmikadi Vyapadesha. Dosha Dikyata, by seeing Dosha Dikyata, we say Sleshmaja, Pittaja, Vataja Prameha, like that. We know that. And among the Tridosha, once again, it is said in a text, Kapha Dosha leads the Prameha. That is Yakshma Pinasa Mihadin Kafajan Kafasangatam. Charaka, he says it is kapha that leads the disease. That is the basic factor, that without that disease cannot manifest. And it is also told in some other context in Charaka Chikisa, Asya Sukam, Swapna Sukam, where he says Kapha Kricha Sarvam. Kapha do Tridosha, kapha is invariably affected and kapha dosha leads the disease. That is the Upadana karma. Further, why and how? Kapha, how and why? He says, Bahudrava Shleshma Dosha Vishesha. Charaka says, Bahudrava Shleshma Dosha. That is Shleshma, particularly Drava. That is Bahudrava Shleshma Dosha Vishesha iti Bahudrava eva kapho mehajanako na alpadrava. It is all about Drava, the solvent. It is all about solvent. How? He says, Kapha is responsible for different manifestations in the body. The Kapha Dosha Dushti likely to manifest a different manifestation. It is told in Charaka Sutra. He says, Swaitya Shaitya Kandu Stairya Gaurava Sneha Sukti Kleda Upadeha Banda Madhurya Chirakaritwani Shleshmani Karmani. That Kleda, Shleshma is Shleshma or Kapha Dosha is the Upadana Karana in this particular disease, because the Kleda Dikyata is observed in Prameha. That is the basic factor in the Prameha. So that is the reason it is said that among the Tridosha, Kapha Dosha is important. That is a basic factor without which the Prameha cannot manifest. That is told as Bahudrava Shleshma Dosha Vishesha. And Dosha is more than the Dusha, and we know that Medo Dhatu, which is Medo Dushta Vikara, Medo Pradosh Vikara Prameha. And of course, the Basti Avayava is also affected. What is Basti? For me, the Basti refers to kidney, ureter, bladder. In short, I would like to conclude it is kidney, ureter, bladder by giving the description of Basti. Basti Puranam Vikledakran Mutram. What is the description? This is Sushuta. Basti Puranam Vikledakran Mutram. Basti Mutrashaya. Tasya Puranam. It fills the Mutra. That is the bladder. Then Vikledam Ardratvam cha. Mutram Karavati. Vikledam Ardratvam cha. The kleda is segregated from the udaka. Kleda is segregated from the udaka. That is Mutram Karavati. That is, formation of urine also takes place in the basti. And Vagbhata said, Mutrasya Kleda Vahanam. Kleda Vahanam refers to Kledasya Bahir Nirgamanam. That is elimination of kleda in the form of mutra. So basti is nothing but kidney, ureter, bladder. Of course, there is a separate description, a separate class is required for that. Anyway, now let me continue. So basti avayava is affected, that is the kidney, ureter, bladder is also affected in this particular disease. And we know that Meda Samshayastu Pratyakshame Ninditani Pramehanam Purorupani Yanichaha, that is Meda Dushti results in Saulya and Prameha. Of course, that is also involved in this particular disease. And Dashadushas are involved. We know that Dashadushas, Tridosha, then Medo, Asra, Shukrambu, Vasa, Lasika, Majja, Rasa, Oja, Pishita, and Chadusham, Pramehanam. So Dashadusha, we know all these Dashadushas are involved. Further, it is said that Yadyapi Meda Praprutayo Dusha Iha Uchate, Tata Api Medo Mamsa Sharira de Kledanam Avasham Bhavitaya Parigrahya Majjada Yascha Sarvamehe Na Punar Avasham Dushante. Among the Dusha, Meda, Mamsa, and Sharira the Kleda are invariably involved in all types of prameya. Involvement of other dushas are not mandatory in for all other varieties of prameha. If at all involved, stokamva, little involvement may be there in other types of prameha. So with this, Kapha prameha refers to kapha pradhana dosha, along with vata, pitta, meda. Meda refers to mamsa and kleda also. Pitta prameha, pitta pradhana dosha, vata, kapha, shonita, meda, mamsa and kleda. Vata pradhana prameha, vata pradhana dosha, vata prameha, that is vata pradhana dosha, kapha, pitta, vasa, majja, meda, mamsa and kleda. So this is the how the dosha dusha in vataja, pittaja and kaphaja prameha. Now, we know that dushas, 10 dushas, among which different dhatus are there. An excess of abadda meda, mamsa, shukra, shonita, vasa, majja, lasika, rasa, oja are mentioned. What is this? It is abadda meda. Abaddam iti asamhatam. It is not fixed. Asammatam. It is not together. That means not fixed. Atratu bahutvam aganatvam. It is not fixed and formed. Aganatvam, not formed. The dhatus are not formed in this particular occasion. In the prameha disease, dhatus are not formed properly. That becomes abaddam. If it's samyak formed, it is properly formed, then it is normal dhatu. Whereas it is abaddam, abaddam is not formed properly. So that is what? So abadda meda, mamsa, shukra, shonita, vasa, lasik, vasa, majja, lasika, rasa, ojas mixes with shariraja kleda. Because it is also mentioned, udaka is shariraja kleda or udaka is involved. So one is solvent, another is solute. All these are solutes and mixes with solvent, that is shariraja kleda, resulting in excess of shariraja kleda. Because whenever there is excess of abadda medadi, naturally excess of sharira kleda, ultimately prabhuta avila mutrata. We know that kleda is carried to basti. Kleda is carried to basti, and kleda is cleansed. Kleda is carried to basti through the ambuva shrotas. It is very clearly said by Charaka, ambuvanam sarvasrotasanam udadireva apaganam pratisthaha. That is basti sula goda mushka sevani. There he says ambuvahanam sarvasrotasam udadireva apaganam. Ambuvaha srotasam pratishteti sthanam iti arthaha. Udadirita apaganam puraniya sthanam tata bastirapi ambuvaha srotasam vishrama sthanam. So ambuvaha shrotas, when it reaches the basti, it gets cleansed. The kleda is cleansed in the basti. That is the reason it is told ambuvaha shrotas, the basti is the vishrama sthana. It gets cleansed. The ambu gets cleansed. The unwanted material is cleansed at basti. So that is the description by Chakrapani, Charaka Siddhisthana 9th chapter. So now, coming to the Samprapti Gataka is over now, Samprapti proper. So to understand the Prameya Samprapti, it is better to look into Sushruta. Tasya cha evam pravruthasya. That he has mentioned 2 lines of sloka regarding the nidana. So tasya cha evam pravruthasya nidana. Ahara and achara, vishets kapha pradhana dosha, acts as external milieu for the disease Prameya. Then he says, tasya cha evam pravruthasya aparipakva eva vata pitta shleshmano yada medasa saha ekattam upetya mutravahi srotamsya anusratya adogatva baster mukam ashritya nirbhadyante tada pramehan janayanti. Now he says, he brings a term, he called it as aparipakva. The term is aparipakva. What is aparipakva? Aparipakva means ama. The Dhalana says, aparipakva ama. Medaseti atra api shabdo lupto drashtavya tena vasadayo grahi. Anyati medascha aparipakva iti patanti. Chakarena anuktani vasadin samuchinvanti. So that is Meda, Mamsavasa, all that factor, that's dushas, all other dushas. They're aparipakva. That is what I said. All these abadda medadi, that is not samyak form. That means there is a derangement in the metabolism of the different dhatu. Derangement in the metabolism of different dhatu, mainly the meda. Mainly the meda. That is responsible for prameha. That is explained by Sushruta. Now we know that there are only 2 diseases are mentioned in Charaka Samhita in relation with the Medavashrotas. That is Staulya and Prameha. And let us compare Staulya and Prameha. In what way they are similar, in what way they are different. And this particular understanding is very essential to understand Prameha also. So if you go through Sushruta Samhita, Sutrasthana 15th chapter, where he explains Staulya, he says, Rasanimistamevam Staulyam Karsham cha Tatra Shleshmalahara Sevino Adhyashana Shilasya. That means excess calorie. Shleshmalahara Sevina Adhyashana Shilasya, excess calorie. Then he says, Avyayamino Divasapnaratasya. A person not at all utilizing the calorie, not at all burning the calorie. So there are only 2 factors that is responsible for the Staulya, that is excess calorie intake and not at all utilizing the calorie. And if you come to Sushruta's description of Prameha Nidana, Diva Swapna Avyayama Alasya Prasaktam. This particular description denotes a person not at all utilizing the calorie. Then he says, Shita Snigdha Madura Medya Dravanna Pana Sevinam Purusham Janiyat Pramehi Bhavishyati. That means all these excess calories, Shita Snigdha Madura Medya Dravanna Pana Sevinam Purusham Janiyat, that is once again excess calorie. The etiology almost similar. That's the reason they are from Medo Pradesha Vikara. Then the Samprapti, that is the Bahya Nidana is similar. Then Abhyantara Nidana. Cha Amayeva. Tatra Shleshmalahara Sevino Adhyashana Shilasya Avayamino Divasapnaratasya Cha Amayeva. Annaraso Madhuratarascha Shariram Anukraman. This is the description in Sushruta Sutra. Whereas in Prameha Nidana he said, Tasya cha evam pravrittasya aparipakva eva vatapitta shleshmano yada medasa saha ekatvam upetya. So once again in Staulya it is cha amayeva. Here in the context of Prameha Nidana, Tasya cha eva pravrittasya aparipakva eva. Aparipakva means ama or medascha aparipakva. The samprapti, the internal fact, the Abhyantara Nidana is once again similar, that is metabolic error. Then in case of Staulya, Annaraso Madhuratarascha, whatever we consume that becomes Madhuratara. And we know that Madhuratara is going to impart Sneha Guna in the Sharira. That's the reason Madhura Vipaka ultimately results in Atisneha. That is, says Shariram Anukramam Atisnehan. The circulating lipids, the free fatty acids are excess, triglycerides are excess in the body. And these free fatty acids, triglyceride becomes Medo Janayati. It is going to form Meda. Tada Ati, when this Meda, that is Baddha Avastha. When this Baddha was in excess, then it is Staulya. Whereas in the disease of Prameha, it is quite reversal. That is, he says, Tasyacha evam pravrittasya aparipakva eva vatapitta shleshmano yada mehdasa saha ekattam upetya mutravayi srotam anusratya adogatva bastir mukam ashritya. That is, abadda meda along with the dosha reaches the basti. So, baddha meda, that is Prameha. Abadda meda, Baddhameda, that is Staulya, Abadhameda, that is Prameha. And what is this Cha Ama in this context? Cha Ama eva, aparipakva eva, medascha aparipakva. That is nothing but metabolic error, not a digestive error. It is very clearly told. It is very clearly told by Bhanumati Tika, Sushruta Sutra, 15th chapter. That is Chakrapani has commented Sushruta Sutra. That is Bhanumati Tika, where it's Chakrapani says, Ama eveti ivarto ayameva shabdaha raktadi rupena aparinataya apakva iti artha natu amashayasta kayagnir daurbalyat avipachita ityadi nokta. So that is, in this context of Staulya, it is the metabolic error, not the digestive error. Natu amashayasta kayagnir daurbalyat avipachita. It is raktadi rupena aparinataya. It is a metabolic error. And even Dalana also quoted similar statement. He says, Satyam jatrena agnina rasa kadbhavina katha eva kintu dhatvagni bihi apakat ama ityuchate. It is true, Jatragni Mandya results in ama, whereas Dhatvagni Mandya are also responsible for ama in Dhatu level. So, in the context of Prameha and in the Staulya, we have to consider ama as metabolic error, not a digestive error. With this introduction to Prameha, let me move on to Vimshati Prameha. So we know that Tridosha Kopanimitta Vimshati Prameha Bhavanti Vikarascha Pare Aparisankya. This is innumerable. Still we confine it to 20. And all the Prameha Tridosha, we know that. But if you go to Vagbhata says, Dosha Dusha Avisheshe Api Tat Sanyuga Visheshataha Mutra Varnadi Vedana Bedo Meheshu Kalpyate. This is a very beautiful description quoted by Vagbhata. Dosha Dusha Avisheshe Api. Dosha and Dusha are similar, Dasha Dusha. Tridosha and other Saptadhatu, Dhatu among except these except Asti, other Dhatu and Ojas, all these similar things. But Dosha Dusha Avishesha Api Tat Sanyoga Visheshata. It's permutation and combination. The combination of Dosha Dusha Samsarga here, that makes the Prameha different types. And Mutra, and that results in different Mutra Varnadi Vedana. So the combination, permutation and combination of Dosha Dusha, that is responsible for the Prameha Vyadi. So involvement of different tissue, the nutrients, protein, carbohydrate, fat, or other nutrients, the minerals, the ammonia, that is phosphates, the amino acids, different factors. These are all we are going to study in further slides. So all these, the involvement of different materials in the body is responsible for different types of Prameha. That will let us continue with the next slide. The first one is Udakameha. Udakameha. Acham Bahusitam Shitam Nirgandam Utakopamam Sleshma Kopan Naro Mutram Udakamehi Pramehati. So its a translation is like this: urine is excreted in large quantity, which is transparent, white, cold, and odorless. Mostly looks like diabetes insipidus. Diabetes insipidus is defined as the passage of large volume, more than 3 liters in 24 hours, of dilute urine. Urinary specific gravity is between 1 to 1.005. There are two forms, it has two major forms, central and nephrogenic. And diabetes insipidus is usually an acquired disorder, with the central diabetes insipidus having different causes than does nephrogenic diabetes insipidus. In rare cases, central or nephrogenic diabetes insipidus may be an inherited disorder even. Then Ikshuvalika Rasameha looks like ketoacidosis. Atyartha Maduram Sheetam Ishat Pichilam Avilam Kandekshu Rasa Sankasham Sleshma Kopat Pramehati. Moderately turbid urine, which is cold, a little slimy, extremely sweet like sugarcane juice. And the ketoacidosis, diabetic ketoacidosis is an acute, major, life-threatening complication of diabetes characterized by hyperglycemia, ketoacidosis, and ketonuria. It occurs when absolute or relative insulin deficiency inhibits the ability of glucose to enter the cell for utilization as metabolic fuel, the result being that the liver rapidly breaks down fat into ketone to employ as a fuel source. The overproduction of ketone ensues, causing them to accumulate in the blood and urine and turn the blood acidic. Diabetic ketoacidosis occurs mainly in patients with type 1 diabetes, but it is not uncommon in some patients with type 2 diabetes. Then Shitameha, turbid urine passed frequently, which is cold and extremely sweet. That is Atyartamaduram Shitam Mutram Mehatiyo Brasham Shitamehina Ustam Purusham Sleshma Kopataha. And Shitameha, once again, the description is similar to ketoacidosis. There is a study where the urine is cold. Cold urine is because of hypothermia. Cold urine is because of hypothermia. There are different causes for hypothermia. Then we generally say hypothermia and the cold intolerance and the cold extremities. All these are seen in hypothyroidism. But if you see the study in Great Britain, where there is a study that the result is as such, the hypothermia is reduction of core temperature below 95 degrees Fahrenheit, with the most accurate reading taken by rectally. Hypothermia can be caused by starvation, malnutrition, immobility, myocardial infarction, pulmonary embolism, and endocrine disorders such as hypopituitarism, hypothyroidism. British study determined that diabetic ketoacidosis induced hypothermia is more common than hypothyroidism induced hypothermia. The incidence of diabetes ketoacidosis induced hypothermia is 11.8% of all the cases of hypothermia admissions in the world. Whereas hypothermia induced by hypothyroidism, that is just 8%. So incidence, generally we think about the hypothyroidism, but the incidence is higher with the ketoacidosis. So ketoacidosis, once again, Shitameha, is likely the urine may be cold. Further, Sandrameha, that looks like proteinuria. Etcha parishutam mutram sandri bhavati bhajani purusham kapakopena tamahu sandramehina. Sandramehina yan mehati tan parishutam ratrisitam gani bhavets. So turbid urine which gets condensed over time or overnight. So there are two descriptions. So over time or overnight. So Sandrameha looks like proteinuria. Proteinuria identifies patients with renal damage and those at risk for worsening renal disease and increased cardiovascular morbidity. An individual with proteinuria in the setting of a normal glomerular filtration rate is at high risk of progressive loss of renal function. The normal mean albumin excretion rate is 5 to 10 milligram per day, with an albumin excretion rate of more than 30 milligrams per day considered as abnormal. Albumin excretion rate between 30 to 300 milligram per day is called as moderately increased albuminuria. Levels greater than 300 milligram per day are called severely increased albuminuria. Albuminuria that persists for 3 months is considered as CKD. Nephrogenic range proteinuria is defined as greater than 3.5 grams of protein excreted in the urine over 24 hours. Then Sandrameha, there are different understandings, different classifications. Move on to next condition, that is Sandra Prasadameha. Yasya samhanyate mutram kinchit prasidati Sandra Prasadamehiti tamahur sleshma kopataha. So Sandra Prasadameha, urine becomes partly viscous and partly clear when kept over time. So once again, the description similar to that of the proteinuria. Then the description of Surameha explained by Vagvata and Madhava Nidana. Surameha, Suramehi, Suratulyam Uparyacha Adoghanam. That looks like spirituous liquor that is transparent above and dense below. So once again, Surameha similar to proteinuria. Then phenameha, explained by Sushruta, stokam, safenam, acham, phenamehi mehat, that is eliminates urine little by little, being frothy and clear. So that is the description. So Sandra Meha, Sandra Prasada Meha, Sura Meha, Phena Meha, all these are nothing but proteinuria. The different presentations in different individual depending upon the different clinical conditions. So polyuria, nocturia is observed in CKD. Of course, generally the chronic kidney disease, polyuria, polyuric phase. The diuresis phase is also seen. Oliguric phase is also seen. And generally, the diuresis phase predominates the oliguric stage. So oliguric stage is usually seen in terminal stage, but polyuria is in the earlier stage. That is, polyuria and nocturia is observed in CKD even at grade 3 and 4 also. Sometimes this particular polyuria and nocturia, even it is seen in grade 3 and 4, the early stage, it is the osmotic diuresis that results in polyuria. But it is suggested that at the later stage of chronic renal failure, the mechanism of a diuresis increase is not due to the osmotic diuresis, rather to secretion of prostaglandin E2, which inhibits cation reabsorption and stimulates diuresis. So diuresis is seen even in grade 3, grade 4 chronic kidney disease also. So that's the reason chronic kidney disease, not only Mutragata, it's many a time clinically it looks like Prameha, that is proteinuria predominant, that is Sandra Meha, or Sandra Prasada Meha, or Sura Meha, or Phenama. Further. Shukrameha, that is turbid urine as a consequence of spermaturia. Shukrabam, Shukramishram, va Mur Mehatiyo Naraha, Shukramehina, Maustam, Purusham, Shleshma Kopanaha. And that etiology is retrograde ejaculation. The other causes are enlarged prostate, then alcohol consumption, chronic alcoholism, then other important causes, diabetes mellitus. So wherein the Avila, Prabhuta Avila Mutrata with Shukra, that makes a diagnosis. So underlying cause we need to consider, and accordingly we have to proceed. Then further, Alalameha looks like chyluria, Tantubaddam ivam alalam, Pichilam yaha pramehati, alalamehina vidyatam naram shleshma kopataha. That is, turbid urine appears thready and contains slimy object. And another condition, Shaner meha, this is also looks like chyluria. Mandam avegantu krichram yo mutra echanaihi, Shaner mehina mahustam purusham shleshma kopanaha. So once again, that is Shaner meha. Once again, it is said that Shanai Sakapam Rastam Shaner Meham. So turbid urine passes frequently with difficulty. Mostly urine contains kapha or slimy contents. So it is chyluria. So Alala Meha and Shanai Meha, chyluria. So chyluria denotes the urinary excretion of chyle, which is a lymphatic fluid rich in chylomicrons. Chyle flows from the intestine lacteals to the left subclavian vein through the thoracic duct. When an abnormal connection between these structures and the urinary tract develops, chyluria appears. Chyluria is classified as parasitic and non-parasitic, the former being induced by lymphatic filariasis, whereas the latter is caused by medical, traumatic, or inherited diseases. The patient usually reports excretion of milky urine, monolateral flank pain, malnutrition, weight loss, weakness. Urine analysis demonstrates nephrotic range of proteinuria, the lymphocyturia associated with the chylomicrons and triglycerides in the supernatant. Then Sikata Meha, that is cystinuria, that is turbid urine is passed along with small gravels, Murtan, Mutragatan, Doshan, Anun Mehatiyo Naraha, Sikata Mehina Vidyatam, Naram Shleshma Kopataha. So cystinuria is an autosomal recessive defect in reabsorptive transport of cysteine and the dibasic amino acid ornithine, arginine, and lysine from the luminal fluid of the renal proximal tubule and small intestine. The only phenotypic manifestation of cystinuria is cystine urolithiasis, which often recurs throughout and affected individual's life. Worldwide, the overall prevalence is 1 person per 7,000 population, but varies significantly by population. The presentation in patients with cystinuria is similar to that of patients with other types of renal calculi and includes the following: renal chronic urinary tract infections in a young person with a family history of kidney stone, passage of stone or gravels, hematuria, dysuria. Cystine is one of the sulfur-containing amino acids. Therefore, a urine may have a characteristic odor of rotten eggs. Urine analysis may show typical hexagonal or benzene crystals, which are essentially pathognomonic of cystinuria. Microscopic cystinuria is present in 26 to 83% of patients. Disappearance of cystine crystals in the first morning urine is a good index of treatment efficacy. So this is about Sikatameha. Then Pistameha, that is looks like phosphaturia, that is Rastaromum pista rasatulyam pistamehi. That is turbid urine resembling flour solution and accompanied with herculations. And another condition which is called as Shuklameha, once again looks like phosphaturia. The turbid urine having opaque white color, like that of pasted flour. So Pistameha and Shuklameha looks like phosphaturia. Phosphaturia is caused due to excess excretion of phosphate in the urine. Presence of too much phosphate makes the urine appear milky or cloudy in appearance. Any cause of primary hyperparathyroidism will cause phosphaturia and tend to cause hypophosphatemia. In the blood it is less, but in the urine it is more. Phosphate is more. So hyperparathyroidism caused by hypocalcemia or vitamin deficiency or resistance is similarly associated with hypophosphatemia, but the phosphaturia is not seen. Whereas in case of primary hypoparathyroidism, phosphaturia is usually seen. Extracellular volume expansion increases the filtered phosphorus load and dilutes the luminal concentration of phosphorus, resulting in phosphaturia. Ethanol and glycosuria both decreases proximal tubule phosphate reabsorption. So alcohol consumption and diabetes once again increases the symptoms. That is Pistameha and Shuklameha increases if there is coexistence of the diabetes once again. Then phosphaturia is also seen, apart from primary hyperparathyroidism, it is also seen in Fanconi syndrome. Fanconi syndrome is a syndrome of inadequate reabsorption in the proximal renal tubules of the kidney. The syndrome can be caused by various underlying congenital or acquired diseases, by toxicity, or by adverse drug reactions. It results in various small molecules of metabolism being passed into the urine instead of being reabsorbed in the tubular fluid, such as glucose, amino acids, uric acid, phosphate, and bicarbonates. Different forms of Fanconi syndrome can affect different functions of proximal tubules and results in different complications. The loss of phosphate results in bone diseases such as rickets and osteomalacia, because phosphate is necessary for bone development in children and even for ongoing bone metabolism in adults. So Fanconi syndrome, multiple metabolites are excreted, maybe glucose, maybe amino acids, maybe uric acid, maybe phosphate, maybe bicarbonates. And if in a case the predominant of phosphate, that we can call it as Pistameha or Shuklameha. Then next condition is Ksarameha, that is alkalinuria, that is Gandha Varna Rasa Sparsha Yata Ksharastata Vidham, that is Pitta dosha. Now coming to Pitta Prameha, that is urine has a smell, color, taste, and touch similar to that of the alkali. Alkaline urine has traditionally been associated with proteus urinary tract infections, specific infections, that is proteus. And the absence of infection, the clinical condition might suggest other diagnosis. So commonest condition, urinary tract infection by proteus organism. Then the other conditions, metabolic alkalosis, failure of acidification, such as renal tubular acidosis, chronic renal failure, aldosterone abnormalities, or ingestion of certain drugs, salicylates, such other drugs. Then respiratory alkalosis where alkalinuria is also seen. Then the next condition is kalameha. Also, we can call it as alkaptonuria or black urine disease. It's also called as black urine disease, where masi varnam majasram yo mutram ushnam pramehati. That is turbid urine passed in large quantity of black or dark urine. Okay, and this is alkaptonuria or black urine disease. Alkaptonuria is a rare inherited disorder. It occurs when body cannot produce enough of an enzyme called homogentic dioxygenase. This enzyme is used to break down a toxic substance called homogentic acid. The buildup of homogentic acid causes bones and cartilage to become discolored and brittle. This typically leads to osteoarthritis, especially in spine and large joints. People with alkaptonuria also have urine that turns dark brown or dark black when it is exposed to air. The next is Nilameha, that is indicanuria, the turbid urine, which is sour taste and color that of the feather of blue jay. That is Chasha Pakshinibam Mutram Amlam Mehati Unara Vittasya Parikopenatam Vidyat Nilamen. Chasha Pakshi image is there, that is blue jay bird. So the feather of blue jay, the urine color will be like this. That is called as indicanuria. It is indicanuria. Called as blue diaper syndrome is a rare autosomal or X-linked recessive trait metabolic disorder characterized in infants by bluish urine stained diapers. It is also known as Drummond syndrome and hypercalcemia familial and with nephrocalcinosis and indicanuria. Indicans, that is potassium indoxyl sulfate, is a normal constituent of urine in amount up to 30 milligram per day in each and every individual with the cells. It is formed from indole derived from the action of intestinal bacteria on tryptophan. It is usually invisible, but urine containing a large excess of indican may darken on exposure to air, and very occasionally oxidation to indigo in alkaline urine may produce a bluish tinge to the phosphate deposits. In such cases, typical bluish rectangular or needle-like crystals may be seen in the deposits. That is indicanuria or Nilameha. Next condition is Raktameha. We can call it as hematuria. Isram lavanam ushnam cha raktam mehati yonarha. So that is turbid urine having red color, saline taste, and smell like that of raw meat. So now, so the hematuria, the important condition is polycystic kidney disease. It's a genetic disorder in which the renal tubules become structurally abnormal, resulting in the development and growth of multiple cysts within the kidney. These cysts may begin to develop in utero, in infancy, in childhood, or in adulthood. Cysts are non-functional tubules filled with fluid pumped into them, which range in size from microscopic to enormous, crushing adjacent normal tubules and eventually rendering them non-functional as well. The signs and symptoms include high blood pressure, headache, abdominal pain, blood in urine, that is hematuria, and excessive urination. The other symptoms include pain in the back and cyst formation, that is renal and other organs. The other important condition of hematuria is Alport syndrome. Alport syndrome encompasses a group of inherited heterogeneous disorders involving basement membrane of the kidney and frequently affecting the cloaca and eye as well. These are various forms of disease. There are various forms of the diseases, which includes autosomal recessive Alport syndrome, X-linked Alport syndrome, autosomal dominant Alport syndrome. So there is hematuria is a very common symptom in this particular condition. So mainly hematuria is seen in almost all types. In some proteinurias are seen, some variety. The hypertension is usually seen, and edema is seen in some variety. So hematuria is common in Alport syndrome. The next condition is familial glomerular hematuria, also called as thin basement membrane nephropathy, also called as benign familial hematuria along with IgA nephropathy, the most common cause of blood in the urine without any other symptom. So next condition is Manjistameha, that is hemoglobinuria. The turbid urine passed frequently, which smells like raw flesh and looks like the decoction of Manjista, that is Manjistodaka Sankasham Prasham Vishram Pramehati. That is Manjistameha is hemoglobinuria. Hemoglobinuria is a condition in which the oxygen transport protein hemoglobin is found in abnormally high concentration in the urine. The condition is caused by excessive intravascular hemolysis in which the large number of red cells are destroyed, thereby releasing free hemoglobin into the plasma. Excess hemoglobin is filtered by the kidney, which excrete it into the urine, giving urine a purple color. So different conditions, not only that is a hemorrhage, the other conditions, acute glomerulonephritis, burns, renal malignancies, malaria, paroxysmal nocturnal hemoglobinuria, and such conditions, G6, PD deficiency, pyelonephritis, sickle cell anemia, the tuberculosis of urinary tract. So like this, in these conditions, hemoglobinuria is common. Then Haridra-meha, that is urobilinogenuria. So Haridrodaka Sankasham Katukam Yaham Pramehati, that is turbid urine having pungent taste and color that of the juice of Haridra. The excessive urobilinogen may be due to excessive formation of bilirubin by cells of reticuloendothelial system on account of excessive red cell destruction, as in acute malaria, excessive hemolysis, as in pernicious anemia or poisoning by drugs, etc. Excessive absorption of products of blood disintegration, as in internal hemorrhage anywhere, or in lobar pneumonia. So urobilinogenuria, that is Haridra-meha. Then Vasa-meha, that is lipiduria. Vasamishram vasabamva murmetiyo naraha, that is Vataja prameha. So that is turbid urine mixed with Vasa or having the appearance of Vasa. So Vasa-meha is lipiduria. Lipiduria or lipuria is the presence of lipids in urine. Lipiduria is most frequently observed in nephrotic syndrome, where it is passed as lipoproteins along with other proteins. Congenital nephrotic syndrome is a rare kidney disease which manifests in infants during the first 3 months of life and is characterized by high levels of protein in the urine, low levels of protein in the blood, and swelling. The disease is primarily caused by genetic mutation, which results in damage to components of glomerular filtration barrier and allow for leakage of plasma protein into urinary passage. So the next disease is Majja-meha, also called as Sarpi-meha. So Sushruta called it as Sarpi and it is Charaka called it as Majja-meha. Both are same. The Dalana clarifies Vataje Sarpi-meha, Charake Majja-meha. So Majja-meha, Sarpi-meha are similar. Lipiduria or chyluria. So turbid urine mixed with Majja. So Majja-meha and Sarpi-meha, lipiduria or chyluria, that is nephrotic syndrome, is combination of nephrotic range of proteinuria with a low serum albumin level and edema. Nephrotic range of proteinuria is the loss of 3 grams or more per day of protein into the urine, or on a single spot urine collection, the presence of 2 grams of protein per gram of urine creatinine. Nephrotic syndrome has many causes, including primary kidney diseases such as minimal chain disease, focal segmental glomerulosclerosis, and membranous glomerulonephritis. Nephrotic syndrome can also result from systemic disease that affects other organs in addition to the kidneys, such as diabetes, amyloidosis, and lupus erythematosus. Nephrotic syndrome may affect adults and children of both sexes of any race. So Majja-meha, Sarpi-meha, that is lipiduria, chyluria, maybe nephrotic syndrome. Then Hasti-meha, aminoacidinuria, that is Hastimatta Ivajasram Mutram Ksharatiyo Brasham Hastimehinam Avstam Sadhyam Vatakopana. Large quantities of turbid urine frequently like passed like an elephant gonemach. The term aminoacidinuria is applied when more than 5% of the filtered amino acid load is filtered amino acid is seen in the urine. It may result from an inherited metabolic abnormality, in which case the amino aciduria is a permanent finding, or it may be an acquired abnormality which may be either transient or may become permanent. Only negligible amounts of amino acids and glucose are normally present in the final urine in every individual, reflecting very efficient reabsorption mechanism for those organic solids in the proximal tubules. The renal tubular transport defects are specific metabolic abnormalities resulting in excretion of significant quantities of amino acids and glucose in the urine results in amino aciduria. So Fanconi syndrome is the most frequently studied inherited amino aciduria. The syndrome is characterized by generalized amino aciduria and by other renal tubular defects affecting reabsorption of phosphate and glucose. Hartnum's disease is a rare autosomal recessive metabolic disorder where renal tubule transport is defective and causes gross amino aciduria. Finally, the last one, that is Madhumeha or Kshaudra-meha, it's called as Kshaudra-meha by Shuta. And there is an interesting description. So diabetes, the term, the diabetes mellitus, it is compared to the diabetes mellitus. The term diabetes mellitus, the diabetes comes from a Greek word that means to siphon. The most obvious sign of diabetes is excessive urination. Water passes through the body of a person with diabetes as if it were being siphoned from the mouth through the urinary system and out of the body. So that's the reason diabetes, the term diabetes. And mellitus comes from the Latin word that means sweet like honey. The urine of a person with diabetes contains extra sugar, the glucose. In 1679, the physician Thomas Willis tested the urine of a person with with the diabetes and described wonderfully sweet like honey. So it is, even in the Latin, it is called as diabetes mellitus, and the Samhita Kara, they called it as Madhumeha or Kshaudra-meha. Such a wonderful description in our textbooks. So diabetes Madhumeha or Kshaudra-meha, nothing but the diabetes mellitus. And we know Madhumeha, the manifestation, two types. Madhumehi, Madhusamam jayate sa khila dvidaha krudde datukshayat vayo dosha vratapate atava. It is said, Vagbhata said, the Madhumeha manifests in two ways. One is Dhatukshaya, second is by Margavan. And how to understand Dhatukshaya Madhumeha and Margavan Madhumeha? The commentator says, Avruto, Vagbhata says, Avruto doshalingani so animittam pradeshayet Chinaha kshanat purno bhajati kritra sadhata. Dhatukshaya Madhumeha is a progressive illness, a stage wherein a pre-diabetic condition, then gradually moving on to diabetes, and gradually the severity increases. It's a progressive manifestation, wherein apatya, ahara, nidana we can see, and lifestyle, ahara, vihara, everything we can see. Whereas in case of Margavan, the onset is so animittam pradashayet. Animitta. What is animitta? The commentator says animitta means akasmat. The onset of Margavan is sudden. Till last few days, patient is always, he is not a diabetic patient. But all of a sudden, patient develops diabetes. Incidentally found diabetes. And there is no family history also. That is Margavan. So what is the description in Charaka? So this is a description in Vagbhata. How to understand Dhatukshaya? Gradual onset. How to understand Margavanaja? That is sudden onset. With this background, let us move on to Charaka. Charaka Sutra 17. The detailed descriptions of Nidana and Samprapti is mentioned. Guru Snigdha Amla Lavanani Atimatram Samashnatam. So that is Kafapitta Prakopaka Nidana. So this Kafapitta causes Margavana to Vata dosha, Shleshamam Pittam Chamedam Shamamsam Chati Vardate Tair Avrata Gatir Vayur Vojham Adaya Gachiti. So results in Vata Margavana Kafapitta along with the Meda Mamsa causes Margavana to Vata dosha and brings this Ojas to the Basti and results Madhumeha. This is a description we generally come across in Charak Samhita. And what is this kapha pitta causing margavana to vata dosha? To this, we need to go through a different description in the text, Charaka, as well as Madhavanidana. Yastu margavarena vayuhu kupyati sa avarka dharmitaya prayena samo bhavati tatra cha langanam matraya kartavyameva. This is Charaka Chakrapani commenting on the Jarachikisa, commenting on Kafaja Prameya. He says, Yasya margavaranena vayukupati sa avarka dharmitaya prayena samo bhavati. Margavana generally sudden onset. That is very important for us. Samadosha itself is considered as margavana. In the text, it is accepted that Samadosha is nothing but margavana. And we know that in Madhukosha, Madhavanidana, it is said that Amam Annarasam Kechit Malasanchayam Pratama Dosha Dushtim Kechit Amam Prachakshate. Ama is of three types. There are three types of Ama in different diseases. Amam Annarasam, the diseases pertaining to the GAT. That is Agnimandya, Ajirna, Amlapitta, Atisara, Grahani, Pravayika, such diseases. Amam Annarasam. Kechit Malasanchaya, some disease wherein you can see Malasanchaya, Udaradi disease, such other diseases. Pratama Dosha Dushtincha, some diseases are because of Dosha Dushti itself. And Dosha Dushti itself is considered as Ama in such for that particular disease. So now with this, we know that how come Dosha Dushti is Ama? How come Dosha Dushti is Ama? What is the understanding? Viruddhe rapinatayete gunarganti paraspara doshas hajasatmyam avisham goramahi. Doshas are made up of viruddha guna. Vata is ruksha, kapha is snigdha, vata is shita, pitta is ushna, kapha is shita. Vata dosha, pitta dosha, kapha dosha are having different opposite qualities. Different guna and opposite qualities. And whenever there is opposite qualities come into contact, then those who are strong, they are going to win. Viruddha guna sannipate bhuyasa alpa avajiyavate. This is Charaka. This is Darwin's principle, but Charaka told long before Darwin. So that is Charaka Vimana second. Viruddha guna sannipate bhuyasa alpa avajiyati. So whenever there is Viruddha guna, there should be a fight. But doshas, though doshas are having Viruddha guna, they don't fight each other. They don't fight each other because dosha gunas are sahaja satya to that individual. My blood is not harmful for myself. So that's the understanding in a simple language. So that is the description in Samhita. But Chakrapani says, Paraspara guna utupagatastu yadyapi doshanam prayo na asti eva tata api adrishtavashat kvachit bhavatit. So generally there is no fight between dosha guna. So that's the reason homeostasis. But tata api adrishtavashat. Adrishta means, in this context, adrishta means for unknown reasons. For unknown reasons, sometimes for adrishta karana, for unknown reasons, dosha guna starts fighting each other. That is nothing but autoimmunity. Dosha gunas fighting each other, that is nothing but autoimmunity that is causing damage to our self tissue. So that is, doshas are having opposite guna. Dosha guna doesn't fight each other in an individual as they are satmya to self. Sometimes dosha guna may fight each other and hence a disease. And anye, it is, of course, dosha guna fighting each other, that is considered as ama. In the description is there in Ashtanga also. Anye doshebhyo evati dushtebhyo anyonya murcharam kodravebhyo vishasyeva vadanti amasya sambhavam. Dosha gunas are fighting each other, that is tamaka shvasa. Dosha gunas are fighting each other, that is amavata. Dosha gunas are fighting each other, vatrakta. Dosha gunas are fighting each other, that is pratishaya. Dosha gunas are fighting each other, that is shita pitta. Similarly, dosha gunas are fighting, resulting in margavana janya prameha. That is anye doshebhyo evati dushtebhyo anyonya murchanas kodravebhyo vishasyeva vadanti amasya sambhavam. So anyonya murchita dushta dosha, or fight between dosha guna results in disease. This causes dhatu dushti, dhatvagni dushti, hence prameha. Yatra dhatu pradeshi mandum vannimando bhavati tatra eva ama sambhavat pidakadi utpatti syat. This is Madhavanidana, Atanga Tarpana commentary, where it is very clearly said, dhatu pradeshi vannimando bhavati pidakadi utpatti prameha and prameya pidakadi. That is a description for the clinically to understand. Type 1 diabetes is a chronic illness characterized by body's inability to produce insulin due to the autoimmune destruction of the beta cells in the pancreas. Although the onset frequently occurs in childhood, the disease can also develop in adults. Currently, autoimmunity is considered as the major factor in the pathophysiology of type 1 diabetes mellitus. In a genetically susceptible individual, viral infection may stimulate the production of antibodies against the viral protein that trigger an autoimmune response against antigenically similar beta cell molecules. The faulty lifestyle, the lowered immune status, the autoimmunity, then the disease patient gets a fever, followed by, after a few days, incidentally found to have a diabetes. So that is Margavanajanya. That is Margavanajanya Prameha. So this is about the Prameha. Then few minutes, 2, 3, another 5 minutes. I will take 5 minutes, 5 more minutes. If you go through the Charaka.
Yes, sir. Sure, sir.
If you go through the Charaka, we will get a description, such a big disease, to few descriptions related with the Upadravastu Kalu Pramehinam Trishnati Sara Jwarada Durbalya Rochaka Vipakaha Putimam Sapidakalaji. Some are systemic manifestations, some are the carbuncles, diabetic carbuncles are mentioned. So that is such manifestations are seen. But Sushruta has elaborated based on the Doshadikya, Kafaja Prameha, wherein the symptoms are mostly related with the gastrointestinal tract or cardiorespiratory symptoms. Pittaja Prameha, mostly GAT or circulatory or urinary tract, or sometimes even nervous system, and sometimes hemopoietic system. And Vataja Prameha, cardiorespiratory, then CNS, locomotor, and even anorectal symptoms are the symptoms, the complications. Symptoms may here complication that is seen. So with this, the Upadrava, this Upadrava is not specific for diabetes alone. It is for all other metabolic diseases which we have studied in last, the Vimshati Prameha. It is not only diabetes, it is some other diseases related with the kidney and some other metabolic diseases, wherein we can see these complications also. Further, there is another important questions usually asked by students. So I just wanted to place this here. If you go through the Prameha Pururupa in Charaka, Nidana or Chikitsa, wherein almost similar descriptions are seen. Karapadayu Suptadaho Paridaham Suptata Cha Angeshu. That is generally related with, called as peripheral neuropathy, diabetic peripheral neuropathy. Malam Kaya Chitreshu Upadeha. That is nothing but atherosclerotic disorders. That is microvascular changes and atherosclerotic disorders generally related, compared with that of Malam Kaya Chitreshu Upadeha. That is atherosclerosis related disorders. Then the diabetic complications, right? Then Mutrecha Mutra Dosha. So Mutra Dosha, as per Charaka, Mutra Dosha refers to Mutragata, that is where less urine, right? So that is oliguric or anuric status conditions, such conditions. So how come all these diseases, the complications of diabetes are included in Prameya Pururupa? That is usually asked by students. And it's a big puzzle. It's a big puzzle. But if you look into the narration, if you look into the narration in Charaka Samhita, narration of Pururupa. So if you go through Nidanasthana, Pururupa is mentioned after Lakshana. So after Samprapti, he explains Dashavida Kapha Prameya, then 6 types of Pittaja Prameya, then 4 types of Vataja Prameya. Then he explains Pururupa. After that, he explains Prameha Upadrava. So just before Upadrava, he explained Pururupa. After Rupa, he explained Pururupa. That's a strange description which you generally, which is usually not seen in other diseases. Right? So Pururupa is mentioned after Rupa and before Upadrava. Similarly, if you go through Chikitsasana, once again, Pururupa is mentioned after Rupa. So why this particular description? So with the advent of science, so-called the scientific tools, now even today patient come to our clinic with the complications, with either with the weight loss, either with the tingling sensation in the foot, either with the eyesight problem, either with renal sometimes, And we write investigations, either urine, blood, or different investigation, then we conclude diabetes. Even today. Okay, that's the reason he explained. Now, for a clinician, these symptoms looks like Pururupa. With that symptoms, he could conclude diagnosis. He could imagine diagnosis, Prameha, Madhumeha. But basically, these are complications. These are the complications of Madhumeha. So he explained after Rupa just before Upadra. That is the probable answer which I generally give my students. So for a clinician, looks like Pururupa. Based on these features, generally we write investigation to diagnose diabetes mellitus or Madhumeha. But these are the important complications of diabetes. And hence he explained, Charaka deliberately explained after Rupa, the Pururupas are explained after Rupa, just before the Upadrava. So probably that justifies, this particular answer justifies the question. So with this, I would like to thank, of course, one more questions generally asked by students, that is Tesham Yatkinchit Ahara Vihara Jatam Shleshma Medo Mutra Jananam. How Mutra Janana Ahara is Nidana for Prameha. That is a question asked by students. Tesham Medo Mutra Kapavaham. Mutravaha Ahara. How? So what is Mutravahara? So generally we take the gross food contains proteins, gross food contains fat, gross food contains carbohydrates. Our food, the most part of our food is carbohydrate, which is water soluble, definitely water soluble. And less amount is fat, and it is not water soluble. The end product of protein is mostly water soluble, but it is in less quantity. So what you want to say by saying Mutra Janana, don't take carbohydrate rich food. So Mutra Janana Nidana, the term stands for carbohydrate rich food. So that is the generally I give that answer to my students. So with this, I would like to thank you for giving me an opportunity, the organizers of Diksha Academy. Once again, thank you. And my friend, Dr. Nisha Kumari, for introducing me to share my views of Prameha understanding. Thank you. Any questions?
Thank you so much, sir. Thank you very much, sir, for such an extraordinary, enlightening session on perplexities of Prameha. We will now go ahead to the question and answer session. I request all our participants attending sessions in Zoom and YouTube to raise the questions in the discussion panel. Sir, there are a few questions, sir. May I read it out, sir?
Sure, thank you.
Good, sir. So I like to know, the question is, I like to know in your clinical experience, which medicines you found effective in reducing blood sugar, sir?
Separate talk. See, first of all, the aim of my talk is to have a better understanding of Prameha. Prameha is not Madhumeha. Prameha is not diabetes mellitus, sorry. The Prameha is not diabetes mellitus. First, and in my practice, I use many Ayurvedic formulations, and my experience, the wonderful remedy in insulin-dependent diabetes mellitus, which I generally prescribe IDDM patients, I prescribe Trivanga Basma with Nishamalaki. Of course, I add Ashwagandha. So I take Ashwagandha, Amalaki, Haridra in equal quantity. Say, for example, if I take Amalaki 50, Haridra 50, Ashwagandha 50, totally I give 150 grams, and I add 6 grams of Trivanga. And I prescribe Jivantyadhigata, should be taken with the Jivantyadhigata. 5 grams of this combination with the 5 ml of Jivantyadhigata should be taken before food twice daily. That is a wonderful remedy. I have seen very good results in IDDM patients. And the diabetes, if you are very keen about diabetes treatment, there are varied medicines. There are so many combinations. One of the popular combination in our ZM is Asanadi Kashaya. It is from Sushruta Gana, Asanadi Gana. To that, to so many combinations, which is generally practiced, similar combinations are used. And in the mild to moderate cases, I get good result. Of course, severe cases, I may require to refer the patient to a consultant. But in insulin-dependent patients, they will be on insulin, and I generally add this drug, and I gradually reduce insulin. At Nishamalaki plus Ashwagandha and Trivanga. And my first thing is, I wanted to convey the thing, Pramay is not diabetes alone. That is the first and foremost theme. My theme is, it is not diabetes alone. It is diabetes plus so many other conditions that I wanted to place based on the classical reference. Hope this answer cleared. I have given some clarity.
Yes, sir. Yes, sir. Thank you, sir. Moving on to the next question, sir. Please explain about the genesis of disease in case of Balavattu Vina Apachara Janagam Eva Bhavati Iti Nyayam.
Please repeat.
Yes, sir. I'll repeat, sir. Sir, please explain about the genesis of disease in case of Balavattu Vina Apachara Janagam Eva Bhavati Iti Nyayam.
That is Balavattu. That particular description is from Arsha chapter. That is Purvakrata Karma. Purvakrata Karma, what Chakrapani says, Purvakratam Chakarmiti Jayamana Sahaja Arsho Abhinirvartakam Janmantariya Karanam Tachakarmam Durbalam. One is Durbala Purvakrata Karma, another is Balavat Purvakrata Karma. There are two things. One is Durbala Purva Karma, another is Balavat Purva Karma. Durbala means an individual has committed minimum sins in his past life. He is in Sanmarga only, but unknowingly, he has committed some sins in his past life. And of course, one has to suffer for his karma. Though it is minimum, he need to suffer. And that individual, when he dies, his Atma, that is Ativayika Purusha, will search such a womb where parents are following faulty lifestyle, food and lifestyle. So such womb, they are suffering from a disease, Prameha, say for example, Prameha or Arsha or any other disease. So where in such womb that Ativayika Purusha will enter, then take birth, and that child will suffer from Prameha. Whereas the Purvakrata Karma is Balavat. That means a person has done a lot of sins in his past life. In such occasion, that Ativayika Purusha may enter a womb where parents are totally healthy. Their lifestyle is perfect. And similarly, their grandparents are also healthy. There is no such issue. This is in the family. But Ativayika Purusha at time may enter the Garbha, and the child may take birth, and the child will suffer from the disease. That is nothing but the mutation has taken place in the family. So this is a fantastic description given by Chakrapani. That is there are two reasons for Bijadosha. One is Mata Pitra Apachara, then is Purvakritam Chakarma. And once again, Purvakrata Karma is related with the Mata Pitra Apachara only, because Purvakrata Karma only. If minimum sins, then Mata Pitra Apachara is required, must, for the development of illness. Whereas if past life sins are much more, then sometimes mutation can happen in a family. So child suffers a disease which is totally unknown to that family. So such a fantastic description in Charaka Samhita regarding foundations of genetics.
Thank you, sir. Moving on to the next question, sir. Sir, the treatment for pre-diabetics, sir.
Nidana Parivarjana.
Yes, sir. Sure, sir.
That's
Thank you,
answer.
sir.
Nidana Parivarjana is the best answer.
Okay, sir. Thank you, sir. Moving on to the next question, sir. Sir, polyneuropathy and skin rashes in type 2 diabetes. Chikitsa Vichara, sir.
Again, coming to that, polyneuropathy. So one of the popular prescription in, as per my understanding, in Kerala as well as Karnataka, from the Panchakarma point of view, is Takradara. Is usually prescribed, and I have seen in my 22 years of experience, in about 50 to 60% of the patients, it gives relief in the polyneuropathy. The Takradara gives relief to a certain percent clinically. And I once again would prescribe, because polyneuropathy is because of Vata Pradhana. It's though the symptom is with the burning sensation, some people will, the burning sensation is the complaint, some people it is the tingling sensation, some people it is the numbness, but whatever may be burning or tingling, whatever it is Ashayapakarsha dosha, Ashayapakarsha dosha, it is Vata Pradhan Lakshana. I would like to treat with Vata Hara Chikissa, I would like to treat with Mahavata Vidvamsakasa, I would like to treat with Bharat Vatshintamani Rasa, I would like to treat this condition with ashwagandha. I mix these combinations with ashwagandha. I would like to prescribe Abrak Vasma in my prescription. Of course, it depends in the varied patients, but I will never prescribe Kamadoga. I will never prescribe our Pravala, such Pravala Vasma, because it is against the concept, against the understanding. All these complications suggest Ashaya Apakarsha dosha. The symptoms, polyneuropathy symptom is because of Ashaya Apakarsha.
Okay, sir. Thank you, sir. I think that's all for the questions, sir. Shall we wind up the session, sir?
Thank you.
Yes, sir. Thank you very much, sir. It was really informative session for our clinical practice. And thank you so much for preparing such a wonderful presentation, which showed us the different way for viewing Prameha. Thank you all participants for patient listening and valuable time spent. To know more about our updates, please do stay connected with our social media platforms. When one door closes, another opens. But we often look so long and so regretfully upon the closed door that we do not see the one which has been opened for us. That's all for today's most interesting sessions with lots of new informations for us to close our eyes. Thank you all for joining us. Thank you. Thank you, sir.